Good afternoon, everybody. Today is the Tuesday, January 12th, Board of County Commissioners work session. We're still in special meeting from our executive session this morning. We're out of executive session, but we already called the special meeting, and we're still in special meeting. And I would entertain a motion to go to convene as the Board of Health.
So moved.
Second.
All in favor, say aye.
Aye.
Okay, we're now the Board of Health, and we have a discussion about low-income people's access to health care. And Liz, you can take it away.
Sure, thank you. Yeah, Marky's here.
Marky just walked in the door.
Yeah, she can, we have a seat right in here.
We just convened, Marky, so you didn't miss anything.
Hi, Marky.
Hi, sweetie.
Thanks for coming. And you may know Ann Mullins at the last minute was unable to make it. We know where everybody is, except for Ross Brooks. Hopefully he'll arrive any moment. So I'll start. I'm Liz Stark, the Director of Community Health Services and the PitkinCounty Public Health Director. And I'm here today with a group of public health partners, and I think I'd just like for them to introduce themselves if they could, please. So we'll start here.
Sure. I'm Jackie Scramstead. I'm Regional Director with Mind Springs Health.
Christina Gare, I'm Executive Director of Aspen to Parachute Dental Health Alliance.
Nan Sundin, Health and Human Services Director for County.
I'm Terry Collins. I'm the CFO at Aspen.
Great. So we're here today to resume the conversation about access to care for the low-income Medicaid and Medicare recipients of Pitkin County. We've been to you a couple times before about this topic, so we just wanted to come today to give you an update on some of the activities and discussions that we've been having over the last few months. So I'm just going to start with some background. And there's our man. Come on up, Ross. Didn't miss a thing.
My sincere apologies for being late.
No problem. Introduce yourself.
Hi, I'm Ross Brooks. I'm the CEO of Mountain Family Health Centers.
So just going to start with some background. Back in May of 2015 at our second quarterly Board of Health meeting, Health and Human Services and Pitkin County Public Health came to you with this topic of lack of access to care, affordable, integrated, primary health care for low-income Medicaid and Medicare eligible persons in Pitkin County. At that time, we described to you the dramatic increase in the number of residents who are enrolled in public health insurance plans, and that includes Medicaid, Medicare, and CHP Plus Children's Health Plan. Those are three public health insurance plans. And also as a result of the Affordable Care Act and Colorado's Medicaid expansion. At that time, we had many of the same partners present at that time: Mountain Family Health Centers, Aspen Valley Hospital, the Dental Health Alliance, Economic Services for Pitkin and Eagle Counties, Pitkin County Senior Services, and Community Health Services. We all presented data that described to you the impact of all these changes on the clients that we serve. And I wanted to just review some of the data points that we presented to you at that time. One of the things I want to mention is that to this point, we have not had a representative from Mind Springs Health present at the Board of Health meeting, so we're glad to have Jackie here today. So we've pulled them into our work group, and they're actively represented here today, so that's a nice addition. Some of the data that we presented last time included, or the first time, was that 4,500 individuals in Pitkin County live at or below 200% of the federal poverty level. And an estimated 2,500 plus people are uninsured in Pitkin County, and that includes those areas of Carbondale and Basalt that are in Pitkin County. Also, an estimated 2,767 residents are on Medicare. Those are individuals that are 65 and over, and 550 of those live at or below 200% of the federal poverty guidelines. And at that time, approximately 84 individuals under the age of 65 received Medicare due to a disability. As of July 1st, there were 13 people who were dual enrolled, dual eligible, and that means that they had both Medicaid and Medicare. And then some new data. As of November 1st, we've seen a slight increase in the number of Pitkin County residents who are now enrolled in Medicaid. That number is now 1,570, up from 1,480 since March of 2015. And of those, 15 receive long-term care Medicaid, and those are people who are 65 years or older, who are permanently disabled or blind and low income. 3 children are now on long-term care Medicaid, and as of November 1st, 2015, 111 children are enrolled in CHP+. That just sort of gives you a lay of the land of what the population is that we're talking about. Then in July of 2015, we came back to you, this group came back to you with a vision statement for the work that we wanted to pursue, some goals and some proposed solutions. The vision statement that we presented at that time is that all Pitkin County residents will have access to quality, timely, affordable, integrated medical, dental, and mental health services. The goals that we outlined for you at that time included we want to find a long-term sustainable solution to access to integrated care. We want to provide coordinated care across all provider types. We wanted to designate Mountain Family Health Center as the hub of this comprehensive health care system. And we want no less than 50% and up to 75% of low-income residents to identify with a primary care provider. And there's a term for that now. I think it's attributed. So if you see that term, we want all those Medicaid recipients to be connected to a primary care provider. Some of the solutions, we had 3 solutions at that time that we presented. First one was that Mountain Family Health Center would partner with Community Health Services to open a clinic in Aspen 1 to 2 times a week, sort of on a temporary basis, and do that in coordination with Mind Springs Health and the Dental Health Alliance. Solution number 2, which is more of a long-term solution, was to create Mountain Family Health Center in Basalt as this regional integrated healthcare hub, providing medical, dental, and mental health services there. And the third solution was that Aspen Valley Hospital and Pitkin County would implement outreach efforts to the private sector to really increase awareness and get buy-in and elicit some support and hopefully other potential solutions to this community-wide problem. At that time, you all supported the formation of a multidisciplinary work group, and since then, this group has met 3 times. We've been focusing on solution number 2, and creating Mountain Family Health Center as the hub of care, exploring options specific to securing adequate long-term space to expand the capacity to serve up to 3,500 plus low-income Pitkin County residents annually, and also to expand their behavioral and oral health services in that location. So that's where we've been focusing most of our conversations at the last few meetings. What I'd like to do now is to have representatives from our group sort of speak to their specific issues that have unfolded over the last few months and sort of give you a status of where we're at now. So Ross, if that's okay with you, I'll have you start.
Thanks all for having us today and for your ongoing support of access to integrated care for everyone in our community. So some of the challenges that we're facing today, the first one I'm calling the squeeze. And our partner Aspen Valley Hospital, on who subsidizes the space where we are currently in Basalt, has needed additional space where we are currently. And long story short, that's squeezed about 350 of our current patients who have less timely access to care, or whom we divert to our Glenwood Springs location, or whom, worst case scenario, end up using the emergency room as their primary health care home, and we think that's the worst option for folks. So in the short run, we've got a short-term squeeze for access to care in our current location, and that's creating some consternation that we're working on with Aspen Valley Hospital and with Pitkin County to find solutions. And then in addition, we're unsure about the long-term viability of the current space. And I would just say that there's some things that are up in the air there that we're trying to work out. Ultimately, we want to have a comprehensive healthcare home for these populations for the next 40 years. We've been around for 4 years in the Basalt community, and we intend to provide services for decades to come. So those are the two issues that we're facing. We have two exciting opportunities, and one of which is a capital expansion opportunity through the Colorado Health Foundation so that we could expand the capital needs for medical, dental, and behavioral health care services at the Basalt site. And then we also have a funding opportunity with the federal government called the Oral Health Service Expansion Opportunity, which, long story short, would allow us to expand dental services to patients in need in Pitkin County and the greater Basalt marketplace. So I'll take a pause there, and do
Okay.
you want me to kick it off to anybody else?
Well, I was going to ask Terry if he wanted to comment on behalf of the hospital. I think Ross briefly explained the space issue in Basalt. I don't know if you want to add anything.
Well, it's an unknown.
Terry, if you could come up to the table so you're near the little microphone there for the recording by the grassroots. Thank you.
We have currently a after-hours clinic in Basalt, and Mountain Family shares that space with us. We are seeing really strong growth in our hospital services and have the need actually for more space. And so what we're trying to do is work with Mountain Family and this work group to figure out how to make all that work for them. We are looking at an alternative location in the Mid-Valley, and if that plan materializes, then it could even open up more space for Mountain Family. The problem that creates, though, is if it doesn't materialize, we're in a situation of not only having to stay in our current location, but maybe even having to take back more space. So that, I realize that creates a planning problem for Mountain Family. But we're trying to move that along as fast as we can, but right now just don't have an answer to that. So notwithstanding those issues, we are very supportive of this effort, and we'll continue to provide both financial support and in-kind support as much as we can.
Marky?
Terry, might I ask, are you looking to add offices, or is it clinical space in the Cody Lane?
It would be clinics, physician clinics. Right.
Okay, that's helpful. And for Ross, have you broken out the number of patients that we're talking about between the Aspen, I'm looking at the whole issue around the squeeze,
Yeah.
and I see that alternative one, which was that 2-day-a-week clinic, if we were to consider that as a short-term option and still stay in the Cody Lane as Terry works through that solution, would that be helpful at all?
We've started looking at that a little bit to have a 2-day-a-week clinic up here, probably in partnership with Community Health Services. It's not at the top. The top of our list is to have a comprehensive
Obviously.
health care home there in
That's
Basalt.
long-term.
But we've started looking at that as an option, as a Band-Aid, until we can have the comprehensive health care home. We don't have additional information. We don't have a business plan to present today yet.
It's a couple of years out, even if we decided to do it.
Yeah, I think it would take us at least a year to pull it off, given federal regulations.
Ugh.
So it's, oh, sorry.
Rachel?
I just wanted to clarify something about.
Go ahead.
The space on Cody Lane, is that necessarily where Aspen Valley Hospital's looking at expanding their structures? Or is there another opportunity? I mean, it's my understanding that it might not be on Cody Lane,
No,
where the
that,
existing one is.
Just come on.
just buddy up here.
Looking good there, Terry.
No, we are looking at an alternative location, and so if that alternative location works out, then we would actually free up space at the Cody Lane location. If it doesn't work out, then we're in a position of having to occupy Cody Lane far into the future, and maybe even expand our presence there, which would cause space difficulties for Mountain Family.
And AVH currently owns that space on Cody Lane?
No, we don't. We lease it.
Okay. Thank you for the clarification.
Okay.
Rachel?
Thank you. I just like to say, this is like a big, deep blue swimming pool.
And I don't know how deep it is or where the bottom is. You know, these are not issues I'm intimately familiar with the way you guys are. But I know we're looking all for some permanence in solutions, you know, that it's not, we'll put a lot of money into something and we lose the lease, or we move, or we think we have a medical home and then don't get into the market and find we're shopping for something permanent 5 or 10 years from now when things are much more expensive. And so I guess you guys have probably had these conversations, but we haven't, about what is really going on with the whole Valley's system. We see Aspen Valley Hospital expanding into Basalt, and we see Valley View Hospital expanding into the medical center. And is this competition that is creating better care for our Valley residents, or are we each just trying to get a sliver of somebody else's pie? Is it a competition battle that there really aren't going to be winners because we're not going to drive Valley View out of business, and no one's going to drive you guys out of business? And you know, so I've just been puzzling over what's happening. And I'm also concerned that when you say new clinic space, will those clinics be accepting Medicaid and Medicare patients? Yeah, I mean, or are they becoming, you know, new facilities in Basalt for private insured people only?
Would you like me to address that?
If you can.
I think that depends on the structure of those relationships. As we've expressed previously to this group, if we have a relationship with those physicians where, say, they're employed by us, then we can control the patient flow, Medicare, Medicaid, and so on. If they're independent practitioners, they have their own business and they make those decisions, and we can't tell them what to do in that regard. So I think it depends on how that relationship turns out, which we don't know now because it's too far into the future for us to even be knowing what those relationships would be.
And again, I can understand that all of us have different things in the background, fiduciary responsibilities, obligations, and all, but it would just be nice to hear Aspen Valley Hospital commit to, we are concerned with the care and the medical provision of services to those Medicaid and Medicare patients, as opposed to, well, we don't know how it's going to turn out. And I'm not trying to put you on the spot, but it just really becomes a challenge when you look at a community hospital, and sure, anyone can go there for an emergency room care, but long-term care, keeping healthy in the first place, we seem to be feeling a squeeze within the Valley. And it's not Aspen Valley Hospital. We're very fortunate we have this relationship now, but how do we augment the partnership so that all of our residents in the Valley feel that these institutions are there for them too?
Well, let me say a couple of things. One, with regard to anything that we control, at the hospital, we take everybody. And if we have physicians that are employed by us, we do have a few now, but not very many, they take everybody. So we're committed to treating anyone that needs care, and we're also committed significantly financially. We provide a fair amount of support to Mountain Family, both financially and also in kind, and we're very committed to that going forward. So I guess my answer is whatever we can control, we're doing that, and we intend to do that into the future. But there are some things that we don't control.
I appreciate that greatly, and I'll finish up real quickly. Because I realize I asked a question similar to this at last time we met in the spring, and you had said there are federal regulations and barriers about what you can, quote, force people to do or not do or things like that. And I just still think it'd be nice to really, via attorneys or whatever, explore options of whether the cost of the rent of the office space can be an incentive that you're able to offer people for taking X amount of Medicaid patients or things like that without them actually being your employee. I know you know there may be ones you can't do and the ones you can, and we're in the situation of often finding workarounds with federal regulations, and I just think of this as being somewhat of a fourth option on the potential solutions.
That's a
And it-
specific violation of federal law. People go to jail for that.
So even office rents?
Yes.
So it's a free market
Yes,
concept?
it has to be fair market value.
Okay. But I think that a fourth option that, under potential solutions, would be to see the model expanded of having employee, or Aspen Valley Hospital employed doctors who will take all patients would clearly be a fourth option to add to our long-term list.
And we are actually moving in that direction. And, but you know, they have to agree to be employed by us before we can employ them.
Yes.
But, yeah, we are very, very much committed to that model, and we're moving in that direction. And as a matter of fact, have recently employed a couple more physicians in the community. And we do believe that's the direction to move in for all the reasons that you pointed out.
Thank you very much.
We are doing that, trying to do that.
Appreciate that.
Okay.
Patty?
You know, while I understand that the federal laws about, forcing someone to do X, Y, or Z, but another question in that direction.
Let me clarify what the law says.
Please.
The law relates to the relationship between a hospital organization and physicians.
Right.
And specifically, it prohibits us to incentivize a physician to refer their business to Aspen Valley Hospital. So if we do anything that appears to be a financial incentive to the physician to do business with
Right.
the hospital, that's a violation of federal law. So case in point is Hospital Corporation of America some years ago in El Paso did exactly that. They offered lower rents to their physicians. They had a medical office building right next to the hospital, offered low rents to their physicians in exchange for them doing business at the hospital. A couple of those executives went to jail over that. It was considered by the federal government to be a violation of what they call the anti-kickback law.
Right, right.
So, yeah, we have to be very careful about that.
Well, and I understand that, but I think Rachel's point was a little different than that. It wasn't that you would give them X and they would give you Y. It was that they could lease space in your facility if they agreed to take X% of their client base that were Medicaid or Medicare. I think that's more the direction
Or some
I'm
sort of
thinking.
workaround.
Yeah, so that you're not saying, well, you have to refer your patients to us, we get the kickback business, but you get to rent space in our facility because we have a need we're trying to fill in that building, and maybe this is a way we can get doctors to say, fine, I'll take, 5 patients or 10 or whatever that are lower income or Medicaid, Medicare, because that is a gap we really need to be addressing.
Yeah, we actually already have an arrangement like that, and that you're quite right, that is a different
Yeah,
structure
that's-
than she was talking about. We actually have that arrangement with OB services currently in this community. And that can be done, provided that the physician, again, they're independent.
Right, they can say yes or no,
They
but.
can say yes or no, but we can make arrangements with them where we, in essence, subsidize their low-income people. And as I said, we are doing that, and we'll continue to do that.
Yeah, I think that model needs to be expanded to provide other healthcare services. One last thing, I think it's great that AVH is still committed to helping with this, this low income in the Mid-Valley, as AVH did many years ago by history. AVH used to actually manage that Mid-Valley clinic, and when AVH decided to no longer do that, AVH pretty much promised the community they would continue to assist in that, and I think we need to remember that promise and move that promise forward.
We have remembered it. And we
Yeah,
are remembering
and I'm just I'm bringing it back because I do not want that promise to be forgotten, so,
It won't be.
thank you.
Markey?
I had a question for Terry, and if you will, talking about physician relationships with hospitals and various communities. I think it'd be helpful that we understand the disparity between reimbursement for Medicaid clients for an individual physician versus a private insurance. What is it you see in terms of cost variation between
No,
Medicaid, Medicare, and private insurance?
I'm not an expert in physician reimbursement.
Uh-huh.
I can tell you all about hospital reimbursement, but not so much.
It's
on the
parallel.
physician side.
We do know it's parallel.
I know they get paid a lot less for Medicaid and Medicare than they do commercial.
What I hear about 30 cents on the dollar.
That sounds about right. So that is a consideration for them because they are in essence small businessmen and women, and so they have to balance the number of patients that they take that are Medicare and Medicaid in order to keep their business viable. So that's often the challenge that they're faced with, is the reimbursements for Medicare and Medicaid are so much smaller that, you know, their mix of patients has to be considered in order to keep their business viable.
And a follow-up question. Does Aspen Valley Hospital employ a lot of nurse practitioners other than Nancy Dodge?
No, just that we have a handful of nurses.
Would that be an alternative to lower cost care? You know, that's one thing I notice that GMA does a lot of.
Yes.
Is nurse practitioner. At the same time, over in the hospital employed positions now, no, the notion that just because you're employed you'll take Medicare and Medicaid, I'm not finding that to be totally the case.
Right. As we speak, we're talking about that very subject, and it can be in some situations a good alternative. Not in every situation, but in some it can be.
George?
Ross, just curious. You spoke about having a presence in the Mid Valley and Basalt. And you mentioned the Greater Basalt area, and somewhat back to Rachel's earlier question. You have an office in Glenwood. What's your relationship with Valley View, and then who services the Eagle County residents in the Mid Valley? Where do they go? Which includes the Greater Basalt area.
If I may, could I just respond to Marky's question as well? On the nurse practitioners, we have at Mountain Family 25 healthcare providers at Mountain Family, and for the first time we have more NPs than we have MDs or DOs. And part of that is economically driven.
Right.
But so we're moving in that direction, that to provide affordable health care for low-income populations, it's got to be a mix of NPs and MDs and DOs. George, to your question, our direct relationship in Glenwood Springs with Valley View Hospital is we squat on their land, basically. They subsidize our rent at 1905 Blake, about 10,000 square feet in the Glenwood marketplace. Similar to AVH, who supports our rent and provides other in-kind services at our Basalt space. So VVH and AVH treat us very similarly in those two markets. The Western Eagle County patients, some of them utilize our Basalt space. Is probably about 10 to 15% of the total Basalt patients come from that southwestern part of Eagle County, but the vast majority still go down to our Glenwood site or forego care altogether. And like I said earlier, the worst case solution in our mind is that people start using the emergency room as their healthcare home. So I'm trying to keep people out of Terry's emergency room, and I'm trying to keep people out of Valley View Hospital's emergency room. I want you to have a comprehensive, and out of Vail Valley Medical Center's
Right.
emergency room, and out of Grand River Health's emergency room. I do not want that to be your healthcare home. We want you to have comprehensive, affordable primary care that includes medical, behavioral health, and dental services.
So then how does Eagle County play into assuming their responsibility for their constituents in the Mid-Valley? They just basically let them on their own and to find their own devices to...
Eagle County today does not invest anything into our Basalt location. They're heavily invested in our Edwards location on the Eagle River side, and they're great partners there in expanding that. But to answer your question directly, in southwestern Eagle County, the county itself does not invest today. We're working with them to try to increase that investment, but today it's $0.
Rachel?
Yeah, you know, I wanted to mention, actually, just yesterday I was down in Denver to stand with Eagle County Commissioner Kathy Chandler Henry and Dan Gibbs from Summit County, testifying in front of the Colorado Commission on Affordable Health Care and some of the challenges we're having with the insurance rates in our area. And, you know, this is a small throwaway comment, it may seem, but at some point, after listening to their discussions for a long time, and our own, and even this one today, we need to start sending letters to the federal government and our representatives. They stop balancing the back of the budget on doctor reimbursements, whether it's for Medicaid or Medicare, but every single time. And I just don't think that we're speaking up about that element as much. That's affecting how many doctors are willing to take these patients. And that's something that I think we should, start a vigorous voice on, whether it's coming just out of counties or straight out of, state government, and individual hospitals. But that's a big part of what's happening. I think if you look at the history of the reimbursements over time, they used to be, roughly comparable, a little bit of a hit, and now, down at 30 or 35%. It's absurd. So, anyhow, I do think we should begin a little bit of a lobbying effort at that level and make sure our reps know that.
Liz?
I just wanted to address a little bit what you said at the very beginning of your comments, Rachel, about the landscape of healthcare in our valley, and I think that this work group is thinking about that, particularly now with word that Kaiser is on the western slope, definitely in Eagle County, and within the year moving into the Roaring Fork Valley. So that's come on our radar and definitely may complicate our vision and our goals, but we're definitely taking all that into consideration and learning more about that. And I'm glad that the subject of Upper Valley physicians taking Medicare and Medicaid, I mean, that's where we started with this conversation and have been for many, many years. And it's very important and is a part of the puzzle. But I believe what Mount Family Health Center brings to the table is a different model of care in terms of integrated, a very systematic approach to being a medical home that incorporates behavioral health and oral health. So Upper Valley physicians being able to take Medicaid and Medicare can complement care in our Upper Valley, but I think this whole notion of integrated care is a little bit different than what we might expect from individual physicians.
Sure.
And so there's just so many moving parts to this. I just want to make that point. I don't know if you have anything to add.
Yeah, I appreciate that clarification, and I'm sorry if I
No,
mixed
not at
terms.
all.
I'd like to say one last little thing. I forwarded to Nan, I think, last week. They just announced a $75 million grant, which we could apply to compete for, of integrating healthcare services with other social services within a community, and to try to, again, make sure that you're not just getting fixed, but that your kids are getting adequate nutrition, and there may be family counseling on abuse issues or whatever. And it would be just, it seems like we might be poised to try to apply for a grant like that. It's separate from this issue, but there's so many factors that contribute to a family and an individual's health. But with the Valley Health Alliance, this effort, others, maybe we would be a good rural example for them.
If I could address that, I think our community health alliances will be looking at partnering together to pursue that.
Yeah, to pursue that grant?
Yes.
Very good. That's nice to know.
And it may be more of a Western Slope effort or Northwestern Colorado effort, but I think that will be, I think we will pursue it with a group of community health alliances.
In speaking about the efforts to bring Eagle County a little more onto this side of the mountain here, I'm going to just jump right to the two letters you've attached.
Yeah.
Are you guys going to solicit signatures and support from Eagle County on these letters?
Yes.
Okay, that was a thing that I think is a great idea. Because that way we get them, pulling them a little more to the table on this side.
The other partners, there are many other partners in addition to Aspen Valley Hospital and Pitkin County as well, but certainly the Colorado Health Foundation, Caring for Colorado, Rocky Mountain Health Plans, the RE1 school district out of Basalt, the school-based health center out of Basalt. We have a good and growing relationship with Markey's group through Hospice and Home Care of the Valley. So there's strong community support and state support for this expansion.
And Garfield County?
Well, I should go to Garfield County. I do not have an active ask to them right now, but I will.
If you'd like us to assist, we'd be more than happy to.
Thank you.
He's writing that one down.
Yeah. Patty to Garfield County.
Patty to Garfield County. With an armed guard.
So I'll continue with our theme here and just state what may be the obvious, but in terms of our discussions, the work group's discussions about how to create increased capacity at Mountain Family Health Center. Hopefully you now understand the challenges with that. And it's really come down to just bricks and mortar. Where can we find and create the physical space, and how will it be paid for? How will those operating expenses be paid for to really sustain Mountain Family Health Center in the future? So that's sort of where our work group has landed as of today. Part of the funding question is in front of you, is that Ross mentioned these grant opportunities are pretty timely. Both of these grants are due in February. And so he wants to move forward on those as quick as, obviously, these great opportunities. The other thing that we wanted to just share with you is in your packet is attachment B, which is from the healthcare HICPUP. I know it better as HICPUP.
Policy and financing.
Healthcare policy and financing. Just a snapshot. I think this is for fiscal year 2014-15 that shows you the dollars that are spent in Pitkin County for hospital care versus Mountain Family Health Center and primary care combined. And my big takeaway from this is that it shows you, one thing it shows you is the impact of the Medicaid expansion of adult Medicaid in that year. That's where we've seen a lot of growth. And also the second point is obviously that integrated primary care can reduce those hospital visits and therefore reduce healthcare costs. So that's sort of my big picture summary. Does anybody else want to provide their interpretation of all these numbers? So that's one of our reasons for doing what we're doing.
I would just reiterate the point that we desire people to have a comprehensive primary health care home to get the preventative services you need and to not utilize the ER as your health care home.
When you talk about the primary care physician for a person, do any of the doctors working with you fill that role at Mountain Family Health Services, or do they have to go to somebody in the private sector to do that?
Steve, would you restate your question?
Well, you were talking about one of the goals is to have people have primary care physicians.
Yeah.
Or a certain percentage of them to move that direction. But do they get the primary care physician service through you, or do they have to go elsewhere for that?
So 15,000 human beings utilize our primary care teams, which include physicians, nurse practitioners, dentists, behavioral health professionals, as their primary health care home. And then many of my staff utilize Mountain Family as their primary health care home as well. I'm one of them. I'm a Mountain Family patient, medical and dental, and I should be behavioral health. I'm just in denial about that.
We're working on that.
But so, yeah, both our staff, a growing number of our staff, and then 15,000 people today in the community utilize us as their healthcare home. Did that answer your question?
So you are the home for these people for their health care, their dental care, and their mental health care.
That's right. Now on the mental and dental side, which hear from our partners.
Which will segue to that in here pretty soon.
Significant growth and additional partnership needed there. So might we kick it off to our dental and behavioral partners?
Sure.
Marky?
I had a quick question for you. What's the size of these grants that you're asking for?
The Colorado Health Foundation is $500,000,
Okay.
$500,000.
Is that a 2-year funding, or is it?
It's a 1-year capital funding,
Okay.
which we're trying to leverage with some other funding.
Okay.
And then the dental grant is $350,000 of operational subsidy a year, which is good. Technically, it's a 2-year grant, but it's good forever if we get it, and will be part of the Mountain Family Base Grant, which means it will subsidize dental care for low-income uninsured populations in Pitkin County, Basalt, forever, unless we screw it up, and we won't.
In speaking of the dental grant, would that also cover individuals over in Eagle County, on the true Eagle County side as well, or is it only for this side of the valley?
We are applying for it only on this side,
Okay,
for
got it.
Basalt and southwestern, Pitkin County and southwestern Eagle,
Okay.
and part of Garfield.
Patty?
Throw that in there. We're talking about Medicare, uninsured, Medicare, Medicaid. What about underinsured? I know, and do you bill, so for example, I come in and I have a policy that has a list that's covered of just covered diagnoses or illnesses. So say I come in and I have what I think is a dermatologic, which is covered. Do you guys accept that insurance and assist me in billing it? Or so you would? So if I had insurance which maybe didn't cover preventative medicine, but it covered a specific illness or diagnosis?
So of our 15,000 patients across Mountain Family, 2,200 are commercially insured today. I can't say that's always affordable commercial insurance nor
Or
comprehensive.
what level of it?
What we are seeing is that some of our folks who are underinsured or who have really high deductibles or maybe have a specialty coverage, some of those folks are going on to our sliding fee scale, which has historically been for low-income uninsured populations. But it's really an economic matter that they may not be able to afford the deductibles, and therefore you can go on our sliding fee scale with disclosure of your family income, and that you pay based on your ability to pay and your family's income.
I think the public needs to know that that's an avenue of access to health care for them. I think a lot they think of it as Medicare or Medicaid, and not those who are underinsured or have issues with the type of insurance that they have.
Yeah, and I certainly concur on that. There are, while 15,000 people know about us today, there are tens of thousands that don't utilize us. Ultimately, if we're able to build a comprehensive healthcare home that I know is going to be here for the next decades, you will see us pick up our marketing efforts and our outreach to the community. But I want to know that we're going to be able to provide that service before we start actively broadcasting it and marketing it.
Corky?
I have another question, thinking long-term about the solution perhaps in Basalt or wherever that you're looking at in terms of the Mid-Valley. How many square feet are we talking about? 5 years, 10 years?
Roughly 7,500 square feet, 7,000 to 7,500 square feet means I can provide comprehensive health care every year to 3,500 individuals in Basalt and provide them medical, behavioral, and dental health care services.
And what's your growth per year?
Of patients or
Yeah,
square feet?
in terms of patient population growth, 10%, 15%?
Our growth is really predicated on our ability to build the capacity to meet the demand.
Okay.
So we have no lack of demand. So there have been years in Mountain Family's past where we opened the new Basalt Clinic or we opened Rifle where we grew by 15 to 20%. In the last year, we only grew by 1 to 2% because we didn't we didn't open new clinics last year or expand.
Great information, thank you.
So I'd like to be sure that we get to hear from our other partners. As you know, Mind Springs Health and the Aspen to Parachute Dental Health Alliance are already in partnerships with Mountain Family Health Center, so I want to give them an opportunity to describe some of those partnerships and some of the things they're working on. So we'll let Jackie go first.
Oh, shoot, I sat in the wrong spot.
Oh, my God, moved right over. Sorry, I'm going out of order.
No, that's fine. So I'm with Mind Springs Health, and we are new to this whole coalition group talking about comprehensive health care in the Mid-Valley. So I thought what might be really important is to talk a little bit more in depth about our partnership with Mountain Family and the types of behavioral health services that we are providing. When Ross talks about this comprehensive medical, dental, and behavioral health, what does that look like from the behavioral health perspective? Because there are several different programs. The first program that we partner with Rocky Mountain Health Plans as well as Mountain Family Health is our Community Health Worker program. And so Rocky Mountain Health Plans pays for this person. This individual is half-time right now at Mountain Family Health and half-time in Mid-Valley Physician's Office. And their whole goal is to take people who are high utilizers of the ER, and we're trying to keep people out of the ER and help them utilize lower levels of care. They find these identified people through Rocky, and they do intensive case management, drive people, pick them up, help them with behavior change plans. I think we can all appreciate times when we've thought, oh, I'm going to eat better. I'm going to start an exercise program. I'm going to go to the gym. And when we say it, we really mean it, don't we? Like in that moment, we're like, I'm totally going to do this. And then life hits, and things get in the way, barriers get in the way, the wheels come off of our plan. And I think the same thing is true with behavior change in healthcare. If you have diabetes and your doctor is telling you how to manage your diabetes, you may have every intention of doing that, but then when you leave the office, things happen. And so community health workers are people who follow these folks who are struggling to implement some of those behavior changes and help them with implementing those, getting over the barriers. They're really in the community, grassroots, doing that. We're real proud of this program. I don't know if Ross has talked about this before, but this is one of the pilot programs in healthcare reform. It is a program that I think we just ended our first year of Prime. And in this partnership, part of us getting these people funded throughout our service area was Mind Springs took some risk, meaning that if medical costs reduced, good for us. We got some bonus there. If medical costs increase, we shared that risk. And it's pretty revolutionary for a mental health center to take medical risk, but that's the type of partnership we're really fostering with Mountain Family Health and with Rocky, is how do we really look at treating the whole person and not just silos. So that's our community health care program, community health worker program. We also have integrated care. Our integrated care clinician is a half-time in Basalt, and I think our projections that Ross and I have talked about is at some point we'll probably need a full-time person in Basalt if they are really seeing, if the squeeze is off and they can see the people they want to see, that we would probably have a full-time person. That person currently is funded by Rocky Mountain Health Plan. The reason that person is funded through Rocky Mountain Health Plan is because the billing codes that exist, they exist nationwide. They are not open in the state of Colorado for billing the type of integrated care activities. That is something at a higher level than me at Mind Springs. Our CEO, Sharon Raggio, and others within the state are working to help the state think about opening up some of those billing codes and having a more permanent option for billing integrated care. Our integrated care clinicians are slightly different than your traditional come see a therapist for a 50-minute hour type service. These are really folks, you've come to the doctor's office, you've talked to the doctor, and the doctor has done their medical stuff, and within their assessment they're thinking there's something else going on. Maybe some depression, maybe some anxiety, maybe some stress management that's really affecting this person's overall health and well-being. So I can treat this part of what's going on, but the stress management piece or this anxiety piece, I'm going to hand them over to this integrated care clinician. And they literally, we call them warm handoffs. They walk over and hand them off to the integrated care clinician, or the integrated care clinician comes to that exam room. And then they spend 15, 20, maybe 30 minutes just working with that person on some of the behavioral health issues that may be impacting their overall health and well-being. It's much more short-term. It's very focused on solutions and problem solving. People who come back can check back in with the integrated care person and see how their stress management plan is doing, that type of thing. But it's really integrating that piece of education and teaching skills to folks who are coming into the doctor and where this is a piece of what's going on for them. The other role the integrated care clinician has is there's going to be some people who maybe need more intensive behavioral health services. They may need more than a 20-minute, or a series of 20-minute brief interventions. They really may need a higher level of behavioral health. They help connect them with long-term then, or more comprehensive behavioral health services. So if somebody comes in needing intensive substance abuse treatment, they would be connected with Mind Springs or with another entity who could provide that more comprehensive service or more in-depth psychotherapy or psychiatric medication. So they're really a bridge as well. Because again, it's hard. Somebody may say, hey, why don't you go to Mind Springs and talk to them more in depth about this? And And the person may very well intend to do that when they leave the office, but life gets in the way, they forget, and so this is really somebody who can help bridge that gap a little more. And then that really leads us to the third part of our partnership at Mountain Family Health in Basalt, is we actually have some therapists there stationed. We have an office there who does therapy as usual, the 50-minute hour, the more in-depth psychotherapy, so that if somebody needed that, there is a potential option for them to get it right there on site in that office as a Mind Springs Health patient. So we really have 3 different ways in which we are intertwined in the Basalt office with Mountain Family Health.
Okay.
Okay.
How
Does that make
much-
sense?
How much space do you take up at the Cody Lane, or the combination of the different?
Of the different programs,
places.
in the, currently we have 1 office, I think, but our plan is to have 2 offices there. We also just, we do have a presence at the Basalt School-Based Health Center, so there is therapy there as well, so that's not our only access to the Basalt community, but our long-term plans are 2 offices to be shared amongst that. those
So that'd be
services.
the ideal, what we want to
That's what we're
strive
looking at,
for.
yeah, yes.
Rachel?
I'm not sure I can remember the details, but had heard something in the wind about Mind Springs needing to expand its actual overnight facilities and provide more long-term beds in Grand Junction, because sometimes a longer term is needed. What are those plans in general, and where's that seem to be going?
Oh, goodness.
I may be
John
able
will
to help
know.
you out on
But yeah, I
that.
was going to say,
I'll put on a different hat
Okay.
as a Mind Springs board member, and the project that you're referring to is called the Sanctuary Project by Mind Springs. And it's expansion. Currently, there are 32 beds in Grand Junction. They are typically full.
Yes, they are.
Or overfilled, leaving entities to wait for a bed. I was in my airport mode there. So the Sanctuary Project is a proposal to expand those hospital beds, and I'm forgetting the exact number.
we want to
think it's-
double it,
Yeah, I
Yeah.
believe it's up to 64.
64, and then maintain our transition beds.
With some transition beds in there. They're in the process of fundraising. There's discussions about grant opportunities with the state that will involve the county, so that's a discussion that will probably come back to this board to support grant applications. I know they've been in discussions with hospitals about possibly supporting that. So right now, there's a capital campaign ramping up, and they are in the process of finalizing design of the facility.
Because isn't Mind Springs and then one on the Front Range the only 2 overnight,
Well, there's-
multiple day stay?
There's more,
Treatment
and we're
centers.
talking about psychiatric hospital level of care, so for people who are suicidal, homicidal, gravely disabled, really needing a more structured, secure setting at that point. There are more Front Range hospitals. Mind Springs, and actually the hospital's name is West Springs Hospital. We operate the only one on the western slope.
Right.
So when our facility is full, that means folks in our service area, Aspen, Garfield County, they're being sent to Colorado Springs, Denver, Boulder. They're being sent quite far away from their communities.
Yeah, and I believe Colorado ranks, it's either next to last or last in the number of beds, per citizen for these types of needs. So this is a real need.
It's a real need, and the effects of not having the right amount, and this is a statewide issue. This is really
I
not,
understand.
it's, the state does not have enough psychiatric inpatient capacity. And then the western slope, we even have less. I think where it really, it creates some real serious community issues. And I think you could talk to AVH, Valley View,
Oh, I have to
River
go talk to the
Hospital.
jails.
Yeah, I
That's
think,
where
you
they
know, what
happen.
happens when you cannot find the correct placement for people to go is they end up sitting in an emergency room or hospital bed, sometimes for days. And
Or
that's or jail. And I think that, that's really not the type of health care our communities want our community to have.
Agreed.
And so that's really where we're trying to make some headroads there and have some different options.
Thank you.
Patty?
Is this grant program, is it one of Governor Hickenlooper's new, when he took office this last time, I think he made a stand on the need to supply mental health facilities and beds in Colorado as a whole?
We do have, and you can certainly chime in too, we do, part of, I think you're referring to the crisis grant money specifically, and so we did expand some crisis services, we being Mine Springs Health. And the other thing that did happen, we have 32 inpatient psychiatric beds. We also opened 11, I want to say, transition beds, which is a community stabilization unit level of care. That unit opened and is operating off of those funds. So we did expand our beds by 11 to help meet the population.
Provision of that service.
Yes.
The grant I was referring to will be a different source, though, and we're working on that now.
For long-term.
But it's state,
Correct.
It's a
Yeah,
state
it'd be
grant.
state, yeah.
because I know the governor is very supportive of these issues.
Yes.
And
Yes.
he's very aware of them.
Yes.
And I can go talk to him too if you.
I'll turn it
Okay,
over to
Christina,
Okay.
want to hear from the Dental Health
Hi,
Alliance.
Christina. I'm with the Aspen to Parachute Dental Health Alliance. In our partnership that we're working with Mountain Family Health Centers and public health departments, as well as the Roaring Fork School-Based Health Center, is around. It's called Smiles Dental Home, and Colorado is the second state to implement this. This started in California, and what it is it's a virtual dental home. So the idea is building upon the success that we've had through the co-program with Garfield County Public Health and the Dental Health Alliance, Smiles for Students, and separately the Alliance's Smiles for Seniors program. We've had a lot of success in bringing dental hygienists to locations such as a school or a location near a senior center, so that it's very simple to get people to where they need to be to get the dental services. What this will do is it takes it to the next level. So now each dental hygienist will be trained in a treatment called interim restorative treatment. And this is for a certain level of cavity, the hygienist can fill that cavity right there on site. How that works is there's x-rays taken, they're sent back to the dentist at the dental home, and they make a treatment plan. Some of the children, some other seniors or other adults may have work that is too extensive to be done right there, but those who can, it will happen right away. And the idea is what we've found with our programming, and also the challenges having enough space. Right now with Mountain Family, the only dental clinic is in Rifle, so that's very challenging for the geographic area that we're talking about. And so what's going to happen is we're going to be able to serve more people, and we're going to serve them right where they're at. Right now with our Smiles for Students program, we're really doing a preventative program. This is more of an integrated program in the sense that restorative care will happen on site. And this pilot is being run by Caring for Colorado with some support from Colorado Health Foundation, and we're one of only 6 regions in the state that was selected. So it's really our responsibility to take this. Right now we're in the planning stages. We hope to have sites open this fall. But really what we want to do is create a more comprehensive dental health system. Just like with physicians, a lot of private dentists don't feel that they can take Medicaid because the reimbursements are so low and their costs are very high. And so that's another challenge that we're facing. Those who do potentially in the future could also adopt some pieces of this program. So it's really exciting in the sense that we're kind of creating the same thing that you have with a nurse practitioner. So you have a dental hygienist who has special training to be able to do more, and we serve them where they're at. So there's not the issue of waiting for an appointment. There's not the issue of getting them there or having parents have to take off from work and go long distances in transportation. And so it's really exciting in the sense that this has worked so well in California, and at that time it was a research study, and so the research has shown that this has worked amazingly. It can happen schools like Head Start, nursing homes, that kind of thing, and so it's really designed to go to those people and get them care. What we find with Smiles for Students is often for students it's the first dental care they've received, which is scary sometimes, and that means that we often see rampant decay that has to be taken care of right away. And what we're doing is trying to stop them from ending up in the ER too, because we don't want kids to have to go under with something that could have been completely prevented. So that's a huge thing. And then like with seniors, as I mentioned before, they're living on fixed incomes, even if they don't qualify for Medicaid. They stop going to the dentist, which can be disastrous because their health and the integration of physical and oral is so key. For example, we had a senior who showed up for a clinic in Redstone, and he was scheduled to have a pacemaker put in the next week, but he had major problems in his mouth. So we had to call the doctor and say, this needs to be rescheduled because first this has to be taken care of. And of course, the doctor was, it's important. That's where the integration comes in, because often if the oral health care isn't there, there may be a very good chance that other things aren't being taken care of as well. And so it's just it's a new model, and I really think it's going to make a difference here in our state. And we're excited that we were selected as the region to really make this happen and create more of a system in our region.
Good work.
Well, thank you so much, literally all of you, for all your work taking care of our community. A specific question, I'm just kind of wondering, approximately, any ballpark range, what does it cost to equip a single dental chair office that you would need for a, I have no idea, what is the equipment that they have to buy,
You mean for an actual dental office?
For an actual, yeah, not a multiple room office, but the chair,
Like
the
one chair
drill, the spittle,
and all the stuff.
the X-rays, whatever they need. What is?
I'm going to have to defer to Ross on that. I can talk about mobile.
I just love to have an
but I'd love
estimate,
to have
some
you talk about
idea.
sort of.
We actually don't run any one-chair
Yeah, yeah.
operation, so 2 chairs plus the staff is gonna cost $250,000
To set up.
to set up.
To set up. Okay, well, that's helpful to know. That you have some, and that's what it costs you down in the rifle facility?
Yeah, we have 5 chairs down in.
Yeah, 5 chairs.
So, extrapolate.
And for the mobile, it is, one of the great things is that it is less expensive, but there's still, especially upfront costs with this new thing. Now we'll have to do mobile x-rays. We'll have some new upfront costs. We have a lot of mobile chairs and different things, but then the chair is different if it's for a kid or a senior.
Yeah, yeah,
You
yeah.
have to have a more robust chair for seniors. So there's a lot of things to get into place, and then you gotta figure out how to cart all this equipment around. Right now, we use a trailer, and it can be challenging, so.
Do you also apply sealants to kids'
Yes,
teeth as well?
yes, that's exactly it. With our preventative program for the kids, that's what we were doing. So that's why we focus on 2nd and 3rd and 6th and 7th, is because that's when the molar erupts. So that's when you want to apply the sealant to stop the cavities from occurring. And we have a really high retention rate too. So Kelly, who works with me, our regional oral health consultant, she actually personally checks sealants at each school to make sure that it's being done correctly. So we have we make quality control a very important piece of it, because if the sealants aren't holding, then you're not going to have the results.
Thank you.
So looking at your ideal situation at the Mountain Family Health Center in Basalt, would you would have so many dental chairs in there? Is that what you're striving towards, or would you continue doing more of a mobile
It
sort
would
of
be
a care?
both.
Or both?
Yeah, so the mobile piece is designed to serve those that are not going to get to, but also to get people to a dental home. So a lot of the people we see do not have any sort of dental home. If they do, then obviously they can continue with their current dental home. But this way, they're seen, if they can be taken care of right there, they are, but technically that's Mountain Family, and it's going to be a virtual dental home. Otherwise, they'll go to the site to Basalt or to Rifle, depending on what.
So how many chairs are you looking at ideally in Basalt?
The bricks and mortar would be three dental chairs.
3 chairs,
in
okay.
Basalt, and then we hope to have a robust virtual access, and especially for kiddos and the seniors throughout actually all of our counties, but specifically in Pickens.
Okay. I used to work in a dental clinic in the Army, and then after I got out of the Army, so I understand
Nice.
the interplay between how many chairs and what services you're providing or can provide.
Steve,
Yeah.
can I ask though, within the space for those 3 chairs, would that be in addition to your 7,500 square feet? Or would that be included in
That's a
that?
component of the 7,500 square
That's,
feet.
I like hearing that.
Okay.
Okay.
Yeah, thanks, this is great information, as always, Liz.
Really good. Well, this is a good team we have working on this. So we've asked for 3 action items from the Board of Health today. One is to support the work group in this priority of really looking at the physical location for Mountain Family Health Center and the operating subsidy issues in terms of the funding. Sort of want your blessing for that, to have the work group continue in the direction that we're going. We would like to ask for your support for Mountain Family Health Center as this hub of integrated care, and also your support for Mountain Family Health Center in the pursuit of these 2 grants.
I would make a motion to allow the chair to sign these 2 letters with the support of the board.
Second.
Okay, it's moved and seconded. Is there further discussion?
No, good.
All in favor, say aye.
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 And I don't know what kind of emotion or nod of heads or whatever, but I believe that this board would be in support, of course, of Mountain Health as the hub and Mountain Family Health Center. And for, I think we do need to move forward pretty quickly to look at physical space. And I don't know, John, I'm going to look at you, what Pitkin County can do. Pitkin County has been very involved in looking for physical space in the Mid-Valley region. So we might be able to have some assistance with information that we've already gathered.
And we're at the table, certainly in those discussions, and trying to explore what opportunities are out there and how can we structure partnerships, whether it be with the hospital, other community players, ourselves, to make those viable. The real challenge, as Ross said, is this isn't necessarily a short-term need, it's a long-term need. So how do we look to build something now that's sustainable going forward? And that just takes a little bit more thought.
Well, yeah, I think we'd rather be using our energy to provide the care than to bricks and mortar it for every increment of 5 years. I think we'd like that permanence.
One thing I'm impressed about this is it's an integrated thing, not just looking at medical care, but it's medical, dental, and mental health care all in one facility, like one-stop shopping. And this could set a good example for the rest of the regular medical, dental, and mental health care for the rest of the country, which are in their silos off in their separate locations. So I really like this model. It's terrific.
Anybody else have anything?
Okay, yeah.
So, 2 things. One is, I don't know if Christina knows, but the Board of County Commissioners of Pitkin County launched the Aspen to Parachute Dental Alliance with funding.
I do know, thank you.
And so what's exciting about that is how far it's come from an idea and a concept all the way to integrated care and specialty care and innovative care. So what the board does, what the Board of Health does, really does make a difference in the long run. So I'm excited about that. And then with that in mind for the Board of Health, as you all know, we're doing a public health assessment on the structure and function of public health in Pitkin County. We've hired Keystone Policy Center. Liz and I are working on that together. They're going to be coming the last week of January and they're going to be holding some small focus groups with stakeholders. And I'm looking for Board of Health volunteers who could possibly meet with them to talk about the public health landscape, your observations, your concerns, what you see as strengths on Monday the 25th or Thursday the 28th in the afternoon. So if you guys could let me know, we didn't want to have a full Board of Health focus group because it's very public, it's on television, and we're still scoping out and assessing, so there's really no need to have it be a public effort. But we'd love to have 2 or 4 volunteers that could meet in 2 different groups.
Yeah, and I'm out of town all that week, so I'm not available, but is
I'll have to
anybody?
check my schedule for the 25th.
Yeah,
I know
if
the
you all
28th
want
I'm
to check
out,
your
but-
schedule, and then we could let Nan know.
25th, I could work. I think I could
Yeah, I
work.
might be able to. I haven't.
Yeah, you and I could do it.
Yeah.
Great.
In the afternoon?
In the afternoon, and I'll send you an invite.
Okay.
Okay?
Yeah, I'll
I
check.
could do it the morning of the 25th.
Okay, let me see what I can do.
Okay, or just be in touch again and I'll tell you.
Fantastic. I will,
Yeah,
look at
keep-
you guys,
yeah.
if anybody else is
Keep in touch
interested,
and I'll
let
check
me know.
to make sure.
Thank you.
Thank you.
Okay, thanks, Nan.
That's it.
Thank you for
Thank
your
you.
Thank you so much.
Okay, I'd entertain a motion to come out of the session as Board of Health and to end our special meeting also.
So moved.
Second.
All in favor of adjourning, say aye.
Aye.
Aye?
Liz?
Okay, thank you.
Yeah, good to see you guys. Good to see you, dear. See you
Good to
later.
see you, Marky.
Yeah.
Monday afternoon, is there any time that doesn't, they kind of like to have mid-afternoon off. Would you be okay like at 3 o'clock?
I would probably do a 3.
3? 3? All right, I'm
And I
gonna
could,
set that
and
up.
if I need to do
Okay, moving on, our agenda. Next, we have a discussion of the future agenda calendar.
Thanks, Steve. Few things to talk about on the future agenda calendars. First, we had set up or have set up a date on January 26th for a joint meeting with Basalt. One of the things that Rachel reminded me of, and I may have gotten wrong on this, Rachel, when we talked, was this date is going to fall directly in between the two meetings. February is the last public meeting. We're holding 2 public meetings. So there was one discussion about getting together with Basalt in January to talk about the river park, and then there was a discussion about, did we want to do it after both meetings were done. I did talk to John Ely briefly, who thought the main work of the first meeting was identifying the types of improvements that the public wanted, and so they will have that, and so he thought the 26th was fine if the board still wanted to do that. But I just wanted to do a quick check-in with the board if you're still comfortable looking at the 26th. The Basalt can't meet until 6 o'clock on that day, so it's a little bit later than when we've met before.
Can I ask a question?
Well, if we meet at 6 o'clock, will we meet at 6 o'clock? You know, because last time we got down there, we kind of got shuffled around and we didn't really have adequate time to really discuss the issues. I want to make sure that we're going to make, I don't have a problem going at 6. I just want to make sure that we have, yeah.
Yeah,
You
and
know what I'm getting at.
yeah, and I think it's a discussion we need to have, because we've got a specific thing that we want to talk about with the river park. I think Basalt is still wanting to also have discussions about topics of concern for them, and so it's possible we need to set up maybe a series of meetings throughout the year to kind of give ourselves adequate time, because if we try and compress 4 or 5 big topics like we did last time, we get 10 minutes on each, and it's probably not enough time for you guys
I'm
to
more
really
concerned
speak.
about what they'll be serving for us for dinner.
Yeah.
Well, that's a whole nother discussion.
And do we have to smell it in the other room before we?
But I don't have a problem meeting in January. I think would be important to have at that meeting, if possible, is based on some of the models and some of the feedback from the first public session, is to have some idea in terms of cost for different items. Because I think that's going to be a point of discussion in terms of, well, how much is this project going to cost, and what are all the amenities, and then the reality is, where's this money going to come from?
And I think we'll be prepared to do that from the first meeting.
And I would agree with you that, you know, Basalt tends to throw a lot of things on the table, and we don't really have adequate time to address any of them. So I think a series of meetings would be better. And some of those meetings, I think, would probably also be an opportunity for Eagle County to participate again.
Michael?
John, you said river park, you mean kayak park? don't
The
you?
kayak park, yes.
There's
yes.
a lot of river stuff going on down there, and I don't want to confuse people.
Thank you for that clarification. Yeah.
The other thing is, what is our financial commitment today? Is it just the placement of structures in the river to form a kayak park, and now we're, because you seem to be implying there's other stuff to go along with it? What is the general commitment here?
I don't think at this point, this board has made a final determination on the project. Where we started off was a commitment to first do the in-stream improvements related to the RISD. That's been I believe the primary goal of our board. However, there's been the follow-on discussion that with that in-stream improvement, there may be a need for other improvements on, whether it be infrastructure or amenities associated with those in-stream improvements. And that's been the topic of discussion, I think, really around a lot of the public meetings, and that discussion needs to come back to this board for approval. So there hasn't been necessarily a hard commitment there, but there's been a willingness to explore that.
So the commitment for in-stream structures has been recommended by the Healthy Rivers and Stream Board.
Correct.
We approve of that. That achieves one of our major goals, which is the preservation of a RISD. So that's sort of stage or phase 1 of the project. Phase 2 might be the streamside improvements and that kind of thing. And that might, some of that funding might come from Healthy Rivers and Streams, but it might come from the town of Basalt, it might come from GOCO, it might come from Eagle County or something like that.
Hasn't been.
So that's also part of the discussion, is who's committed here to this project beyond the structures in the stream. Is that right?
Yes, and I'd say there's probably a third issue that's really to be determined, which is, is there going to be more amenities developed by the town, Riverside kind of park amenities, that maybe this would connect to in the future. But that is clearly a future discussion, because they've got a lot of decisions to make before we can even engage in that.
Okay, and so given that commitment to the in-stream structures, do we have permission as of now to do those in-stream structures?
Well, there was an approval, I think, that included some out-of-stream improvements to manage traffic and manage some of the safety issues. That also included the requirement to do these public meetings to identify improvements. So this is maybe a little bit of a gray area, Michael, that, you know, the town's approval right now does include some of those out-of-stream improvements and really desire for us to have that community discussion to identify what other improvements or amenities may be needed. We frankly just haven't had the funding discussion around those.
So I'm just trying to clarify our discussion with Basalt because I need to know what we've committed to, what we have permission for, and and then I would like to know what the vision of Basalt is in terms of, or the people who've input to this public hearings, what their vision is for that area. So.
Well, I think what we do for prep, you know, I think it'd be best to have Lisa and representatives from Healthy Rivers and Streams come and talk about the meetings and their understanding of where we're at on those fronts as a prep. And then we can try and structure an agenda, you know, around that kind of discussion with Basalt. You know, what are your aspirations here? How does this fit in? How do we work together going forward?
Right. Okay, thank you, John.
George?
Yeah, and Michael, when Basalt gave the approval for PitkinCounty to do the in-stream structures, they did have some requirements to go along with that, and those have they've got a budget. I mean, they've got a fiscal responsibility to go along with that. So it'd be nice to know a ballpark what those costs will be that the county is going to be responsible for. And then above and beyond that, it depends on what Basalt and the citizens really want to see in terms of any additional amenities or not, and projected costs, and then how will that be funded?
And that's something we can get through Healthy Rivers and Streams. And so what I had based on, oh, sorry, Rachel, I didn't just saw you out of the corner of my eye.
John, go ahead and finish and then we'll have Rich.
What I was just going to say, I think based on this discussion, what would make sense is for me to go ahead and meet with Mike and kind of map out those various topics and how we might structure maybe a few meetings with adequate time to talk. So we're hitting on those we have a vision that yes, we're going to talk about these things, and here's a timeline, and then structure this meeting on the 26th around, you know, what we've talked about here.
Okay, Rachel?
Yeah, thank you. And yeah, thank you, Michael, for your questions. I think they add a lot of clarity. My notes were exactly the question mark behind what is the structure of the meeting, and I think everyone said it, but we need to just ask that this meeting be about this one topic, and we'll be happy to set up future meetings about other topics. And then kind of concurrent with what you were talking about, I think, is also the concept of phasing. You know, what has to happen for a public safety standpoint of amenities connected with the river structures initially, and then what are other amenities that might be, you know, add-ons over time, or the opportunities in the initial planning and layout allow for that. So phasing's got to be part of that. The other thing that really strikes me, though, is that we're holding the meetings in Basalt, and that's appropriate outreach that way. But I want to make sure we're reaching and hearing from other river users as well. You know, this is a little, you know, it's a amenity for all users of the Roaring Fork River. And, you know, I'd hate to see it become so localized that there's not voices of other people, whether they're the Fly Fishing Coalition or kayak users or our local rafting companies. You know, have they been invited? Are they notified? But it's not, it is physically located in Basalt. It should be a great amenity, Basalt, and like to plan it a bazillion % along the lines of what Basalt wants. But at the same time, the taxpayer dollars come from all of PitkinCounty, and all river users should, you know, have that chance to weigh in, or we should make that opportunity available.
At the meeting that George and I attended, George, and let me know if you agree with this, there was a wide variety of users there, from fly fishing guides to rafters to floaters to kayakers to, just water users.
Oh, good, okay.
Yeah, so it was a good turnout, a very diverse turnout, and I think they are keeping in contact with all those different groups and keeping them involved in the loop. Right. Yeah, that is a good point, because it was just not everybody was there.
Yeah, thank you, Patty, for that
Good
clarification.
turnout.
Okay.
Okay.
In terms of that meeting, John, I'm out of town that week, so you don't have to worry about what time to meet on my schedule.
Okay. Other item, just to note, we had at least calendared in the board's retreat for February 2nd and 3rd. We did have a joint meeting. I did talk to the city about moving that, and the one thing that stuck in there was that they had planned to talk about housing guidelines, and they were possibly bringing a consultant in that had been doing some work. I think Rachel and George, maybe you were part of an interview process with that group a while back. They're not sure that that's going to happen on that date, so I'm waiting to hear. I'm wondering if you guys would be open if the consultants were scheduled to be coming out at that time, scheduling our retreat in such a way that we could go to that joint meeting, at least for the housing guidelines discussion.
So you're essentially talking about ending our retreat day on Tuesday, say at 4 or 4:30, and then going over to a 1-hour commitment with the city, and then going from there. In a sense, I'm okay with it. On the other hand, it's probably a major project we haven't seen or discussed among ourselves yet, and we don't have agenda time to discuss those guidelines first among ourselves and what we think they are. So I'd want to make sure if everyone's seeing them for the first time and it's just an explanation and there's no action required, we're not signing off on them, that would be one thing. But if the city has previewed them and we're just seeing them for the first time and it's a meeting where we're asking for shall these be adopted, that wouldn't be enough time.
Right, and I did ask that question when we were meeting on it, and it's a introduction. Yeah, and I believe both bodies would be seeing it for the first time.
Board members, what do you think?
Yeah, I mean, you've tentatively scheduled only a day and a half anyway.
Yeah,
So I think there should be plenty of time.
can figure it out.
Certainly if it's that Tuesday, the second half of that half day.
And I think as we go through our next discussion about the retreat prep and kind of getting an idea what those days might look like, we'll have a better idea how that fits. But just wanted to throw it out there since we were on that.
So everyone's okay with that for John?
I'm not particularly anxious to meet with the city after our retreat, but
Yeah, it could make for a really long day if we get there and we're spent already, and then we have to try to have a good conversation with them for an hour. That might be difficult.
But you're always energized after a retreat.
I would rather,
Are we energized for the
depending on
joint
when the consultants are coming, if it could be another week, I think I would prefer that personally.
It very well may be the case, and so I should be hearing back this week. But I wanted to let you guys, or at least make you aware that had been the discussion a while back. They're trying to schedule the consultants for that day.
So we should kind of leave a little open time on the 9th in case that ends up being it. You should just make a note that, we may have a moved item to February 9th. Just so we don't overpack that agenda and then have troubles rearranging again.
Yeah. So I'll get in touch with them. It's more a heads up that may be the case. And then I'm going to be meeting with my counterparts from Eagle and Garfield County, just since they're both new, to kind of talk about what's going on and talk about setting up joint meetings. That's something that you guys had talked about. And we're holding a little bit on setting up the joint meeting with the hospital, which is another one that you guys had indicated you wanted us to be looking at, just to let some of the discussions like the one we just had and around ambulance and that sort of thing mature a little bit so that we can give you guys some facts going into those discussions. So still have them on our radar screen, they're just not showing up yet. That's all I've got for you on future agendas right now.
George?
John, next week we have what's scheduled is a joint meeting with Open Space and Trails for 30 minutes.
Yeah, I don't think that's enough time. I've asked Dale about that. I think my understanding is what they're looking for is a discussion about ballot issue timing, and I suggested we are probably going to need an hour for that, but kicked it back to Dale. I'm guessing each of you is going to need some time to talk as well as whatever trustees show up. So, yeah.
Yeah, I agree with John, your observation, and it seems that if the discussion with the city goes forward as planned, and it's just going to be a presentation of these housing guidelines by their consultants, we're really not going to need prep time, which is on the agenda for the 19th. So that might free up 15 minutes.
Okay. There were a few other items that we could do at that joint meeting. I think they're looking for a facilities update from us and vice versa. So they're just updates.
But if it's
so,
going to be
yeah.
within our retreat day, we're going to do just the one
Sure.
thing their consultants have,
Okay.
and we can send them a memo about our facilities updates.
Fair enough.
Steve. John, one of the things that came up at the previous Open Space and Trails meeting, Tom Oken made a presentation to the board about the renewal of the ballot and everything, and he mentioned that Healthy Community Fund might want to go ahead in 2016 for a renewal of that fund, and so that would implicate probably a change of time for Open Space and Trails, since their renewal actually, I don't think is up till 2020. So, and we haven't had that discussion.
You haven't had that discussion, and staff is prepared to talk about that. We did do a coordinating meeting about a year and a half ago because there are a number, it seemed like, of ballot issues getting proposed, whether it be from the school district or, we knew open space was coming up, the hospital. And so we did just kind of a meeting to try and get some understanding, and at that point, what we had mapped out internally was a Healthy Community Fund going out in 2018, but they would have one bite at the apple at that point. We felt that with the past support that made some sense. The only reason we're looking at open space and trails in 16 versus, I think their renewal's 2021, if I remember correctly, was the question of bumping up against the ratio for operations versus acquisition, which was, kind of pushing, do we need to consider that question a little bit earlier as a renewal and maybe revisiting
But that could be,
so,
they brought that up at the Open Space and Trails meeting, that's actually it's not a fundraiser. They could ask that question as a separate question, not a renewal of the fund itself.
Absolutely. That's a strategy, yeah, kind of
That could
question.
happen, which is not a renewal, because I think the fear was that with numerous requests for continuation of funding requests that piled all together, it might not be palatable to the electorate.
Right, and so we were looking at a 16 and 18 kind of recommendation to you guys for OST and then Healthy Community Fund, but that's kind of the strategy discussion I think that we need to have overall. I agree.
Yeah, thanks for pointing that out, Michael, and maybe we should ask the board as a whole, would it make sense to start the day of the 19th at noon and everyone do a brown bag lunch to a working lunch? And then there would be enough time. I mean, we're scheduled to start from 1 to 4:45, so maybe just starting a little earlier in the day. I don't think that conflicts with your ACRA meetings that day. What would folks think about that? But it's a good discussion, and that we're not going to have it well in a half hour. There's no question about that.
Yeah. So now, and I think we have an opportunity to get that.
Yeah, I mean, the other question really is, and was was sort of implied here at our previous Board of Health meeting, which is, should we consider raising the levy for a healthy community fund to support whatever programs they envision here. So we need to have a discussion with NAN too, it seems to me, about what their goals are and if they want that to be a goal of it.
Can I just jump in? And part of that discussion, I think, is going to be what we're doing with community health. Are we keeping it in the fund? Are we bringing it in the house? Are we, I mean, that's the evaluation that's going on right now, right, with community health?
Right, and so that's gonna probably not be ripe for this earlier kind
For
of
a healthy-
discussion.
Well, yeah, but for a healthy community ballot question ballot
Oh,
question
yes.
in 2018, that would be part of the discussion too, as far as where the monies are going to go and how much money we need to generate.
Yeah, I mean, if we want access, if the issue is access, low-income access to health care, and really our only ability is funding, it seems to me. We may have great ideas, but funding is what is critical to making these programs run. So that's a question.
And, in the bigger picture, so I think open space is one piece, and kind of understanding the opportunities there is kind of the purpose of the early work session. I don't think you have to make a commitment this early, but it's to kind of get those issues on. And then understanding what we have internally, but also what we expect externally is going to be important for timing.
What does that mean?
What other entities might be going out on the ballot when, and that sort
When
of
does
thing.
the community fund expire?
2018, I believe. It's either 2018 or 2019. I need to
It
look.
went before in 2012, and it was for 6 years?
We did
I was just thinking about this.
But it went early, though.
For this discussion, we should have a list of when those
Yeah.
ballot questions went. Were they off-year, on-year elections, and what was the election result outcome? Because I was sitting here trying to think, wasn't the last renewal actually during an out year? And we're kind of focusing on 16 and 18 because of the big turnouts. But I can't remember, and I
believe
don't
it
want to
was
hazard a guess.
12 when it was renewed, and I thought we did. I'll have to pull the
Yeah, so
question.
that's where we need to take a look, because
Wasn't ready to do that whole
Well, and the
discussion
language
right
of the
now.
question, and the language of the question. So I think this is just a good preliminary discussion about these things, the different contingencies and paths it might take. I don't know that the healthcare could possibly be ready for full inclusion this year if we were talking about funding that would be for supporting a new facility. We don't know where the new facility is.
We don't know.
There's a lot of unknowns, and that's the type of thing that people are going to have a lot of questions on. And so that's going to take a lot of prep if that's rolled into Healthy Community Fund, as it very well should be. So I just want to make sure we have this meeting set up to be a good meeting to talk about the different, what the history's been, when they pass, with what margins, what the questions have been, when they're all due for renewal, and then we can kind of start from there.
And so we have two things going on. One is kind of the broader concerns that you have to deal with as the Board of County Commissioners, and then kind of the specific interest of a Open Space and Trails Board to have a discussion about their ballot question. Maybe what we should suggest is delaying the Open Space and Trails Board discussion a little bit to have a work session just on what are the upcoming kind of ballot questions and such. So what I'm hearing, just checking in with you, is that we need some background before you go into this discussion with Open Space and Trails on kind of what do we know about what's coming up and when and the options, and then you can have a better discussion with the Open Space and Trails Board. And maybe what we want to do is, instead of doing the Open Space and Trails discussion next week,
Have the bigger
do
discussion.
a kind of a bigger discussion, broad outline, here's what's happening when, here's what staff was thinking, and use that as a tee-up or background information, and then maybe next week have the meeting on Open Space and Trails. Does that make sense?
Yeah, I think it
Yeah, we have a much larger context than any of these particular issues,
Yeah.
so we need to have the broadest possible look at this.
Okay.
first.
Yeah, I agree with that direction, John, as you've outlined it, and what I would think about doing is kind of augment it, would be to invite a member of Open Space and Trails if they'd like to attend that work session, let them know that, we're not trying to talk in their absence, if they'd like to attend, they could. And then, secondly, if we could schedule the meeting with Open Space and Trails, this was gonna be the 19th, so I don't know if we'd be ready or not, but, before the retreat, because we can use this also as a retreat topic as we're looking into a 5-year plan. And so that way we could have our own discussion first, some feedback, and hear directly from Open Space their concerns, what they're hoping for, and then kind of finalize or come closer to finalizing direction during our retreat as one item on the agenda of the retreat. What was I just thinking? Because if anything's going forward, we tend to do a little polling, we tend to do certain preparatory items, and we have not discussed that, but we could discuss that again a little at the retreat if anything's going forward in 2016. I do want to say that I was kind of taken surprised by the presentation by the Trust for Public Lands. I personally think it's great that they're out there as an ally to help communities that don't have an open space tax or have not yet started an open space program. But I really don't see a role for them in our local elections. And I can understand why any citizen volunteer board would be like, yeah, this is great. We'll pay them $20,000 and they'll do an election for us. But I just can't see doing that. We've always passed them, whether it's Healthy Community Fund or others, with citizen volunteer groups. We do polling as is appropriate and allowed to by election law well prior of setting a question, determining language. But, just as one person, I certainly, again, I appreciate the efforts, and I'm a nonprofit member of the Trust for Public Lands, but I just didn't see us as having a role hiring a group like that.
I think that will be should be part of the discussion.
Yeah.
Just on for future agendas, John, the following week, Tuesday, January 26th, we really don't start till 1 o'clock, so there's ample time to have that discussion with
Yeah.
Open Space then.
Yeah.
And still be timely.
Our agendas are still pretty light,
Yeah.
so it's easy to move stuff, yeah.
Okay. Steve, can I just add on to Rachel? We should have Mitzi or Nan there too then, if we're going to be talking Healthy Community Fund. Same thing as with Open Space and Trails.
Yeah, and I think right now with where we stand, we're not going to be able to give you guys a strategy around those funds so much as kind of the timing.
With the
and
history.
Yeah. Okay.
So, board discussion about the board retreat is...
I still have future agenda issue.
Okay,
I told you kind of in
Yeah.
passing, we'll be out of town from February 25th to March 5th. I will miss the one work session on that Tuesday, the 28th or 9th, or whatever date that is.
Yeah. And then I guess I should just add that I am hoping, I've been asked to volunteer on the hut trip for the 6th grade
Oh, you gotta go.
class, and I'd really like to do it. March 7th through 9th. So
Is that
probably
Shrine
plan
Hut?
on the, I should know
It's
this
Shrine
by
Hut.
now.
It's brutal.
You talked to
I
Tom.
can imagine.
A mile and a half
Yeah.
of pure agony. Those kids are gonna suffer.
Tommy had to pull the card up. You can talk to Tommy about it.
Okay.
You may change your mind and we'll see you there.
so John, also on
It's really fun.
January 27th, I'm not going to be at the meeting, a regular meeting,
Okay.
Wednesday, January 27th. Okay, let's see, we're basically a half an hour behind our schedule right now. If we need a half an hour to talk about the retreat, maybe we don't need that long to talk about it, but.
That'll be up to you guys. What I'm handing out is the agenda that we used for last year's retreat, and really we just set aside time today to kind of talk a little bit about planning for this year's retreat. And handing this out, I don't want to replicate this agenda again. I've heard from a couple of you individually, as well as just kind of thinking a little bit about where do we maybe need input as an organization. And a couple of things I think are things that I'd recommend for the upcoming retreat. One, I think it would be good for us to have structure around discussions, but more time for you guys just to talk as a board. That's something that maybe we haven't had enough of in our past retreats. One of the things that we probably need to spend, at least from staff's perspective, a little bit of time on is understanding what kind of your goals and perceptions are, particularly as we enter into some of our big projects. We've got a lot of big things that we're ramping up on, and I know for me it would be good to set aside some time to understand from your perspective, you know, where are our strengths, where are our opportunities, where are aspirations, what kind of results are you looking for out of these types of projects. I always think it's good too to revisit the previous year and talk about what went well, what were challenges. And so in terms of kind of an agenda proposal, what I'd suggest is structuring the retreat kind of as we have traditionally done, in the sense of spending a little bit of time at the outset of the retreat talking about how we interact as a board, but changing it up a little bit to do a board have each of you do an assessment. Not a self-assessment of yourselves, but just a structured set of questions about how are we doing and how we do our business as a board, you know, in terms of, you know, for example, asking questions about, are you getting the types of information you need? Do you have the right amount of time for discussions? Are we having the right discussions? Doing an assessment using a tool and just kind of structuring a discussion about, okay, where are we doing well? Where can we improve how we spend our time? And particularly how you spend your time together as a board. So instead of doing the more structured team building kind of activities, really just drilling down into how are we doing? Where do we need to make improvements? Do we want to set some specific goals around that? Then going into a discussion, kind of looking backward, doing the plus delta exercise on the previous year. You know, what went well, what were challenges. Looking forward, what are our aspirations? You know, what are our aspirations for the community, to try and get an idea of, you know, the context that you guys are going to be making decisions in, particularly as we implement these big projects. And then really focus back in on what are those big rock kind of discussions that we're having this year, because we're going to be doing some big projects and going through an exercise to talk about, you know, our strengths, opportunities, aspirations, and results that we're looking for around those projects. That would give it's a more specific focus in a sense than what I have at least done with you guys in the past retreats. I think it'd be really good to have some idea, are we on the right track, and what is that right track going to look like going forward? So that's kind of my general thoughts around the retreat. I could be way off base in terms of what you guys would be hoping to achieve.
Patty and
Yeah,
then
I
Michael.
don't necessarily disagree with that. I just thought you were going to make us pick, are we a circle, a triangle, or a...
I'm not going to do that kind of exercise
Okay.
again.
The other thing, I don't know how the rest of the board feels, we may want to bring into the discussion at some point, is our intergovernmental relationships and communications. And how are we dealing with other elected bodies in the valley or beyond? I think that it might be appropriate as part of the retreat to talk about that, since we're looking at how well we function as a board amongst ourselves. You know, I think that we may have discussions about how well we function with other elected boards. And if we have any ideas as to how we can increase that communication level and relationship level.
Michael?
You know, one thing that I've always thought worked well was, or at least in the past few, were the sort of community boards or community members coming in and just sharing with us and talking to us. I think that's been an effective part of the meeting. I think the community members like it. And I'm, you know, I think for me at least, the pace of the community, the change in the community is, and so it's hard to know what community we're in. And at least for me, that's been here for a long time, I'm not quite sure what community we're in anymore. And I'd like to explore that, quite frankly. I don't know how to do it, but what is our community? You know, so there's an article in Fortune magazine, there's 50 billionaires in Aspen, but I actually haven't met any yet. Or maybe I haven't, they just haven't told me, or they haven't bought me lunch. So you know, what is this? What is this community? And I think we need a discussion of that. I don't know.
I did
Sure.
like the community discussion last year.
George?
Yeah, I agree with that. I had on my note, because John, you mentioned one of our conversations should be around what are our aspirations for the community. Well, to have that discussion, it seems like we want to have some input from some community members and maybe make it a little different than we've done in the past. Perhaps bring in community members from other parts of unincorporated PitkinCounty, because, you know,
Aspen-centric.
Yeah, we've dealt with Aspen Central for the most part, but there's, so community is broader than Aspen, obviously, certainly for PitkinCounty. So I think we could pull in some people from around the county to help with that discussion. I think that's always valuable.
Did we have Jackie last year? Was it Jackie and Auden and Chuck Frias?
Yeah, but
I
would want to go with a different direction.
Yeah, I mean, my sense of the community is that it's much larger, actually. It's much more multi-jurisdictional now. I mean, I'm perfectly comfortable shopping in Eagle County or Basalt or wherever, and so that's what I view as, you know, it's not PitkinCounty proper, but it somehow is mixing into PitkinCounty. I don't know how to quite.
Well, if we want to do the panel again, I agree. Those are, yeah, I think those have been interesting discussions in our more recent retreats. I hadn't, I'd say about more just getting you guys more focused on discussions. But if we want to do the community panels, it'd be good, because we're on a pretty short time frame to get folks scheduled now, to maybe get some ideas from you about what does that panel look like to achieve that discussion that you want, and who might be some folks that we want to approach. And sorry to do that on short notice, but I think that'd be a really helpful
So
discussion.
we could probably
Or you could email me.
email you some ideas, we can bring it back next week.
Yeah. Rachel?
Yeah, I had a slightly different take. I have greatly enjoyed the community panels before. But I want to make sure, I think it's been said by others, is to diversify the panel and hear from different sectors. You know, a lot of the kind of business-oriented sector, that the information hasn't changed that much from 12 months ago or 24 months ago. They're very similar issues. I think it was Bill Kane from Assault we had one year, and talked about the Mid-Valley growth and changes and what the ski company sees and others. And again, that's been very valuable, but it makes me think a little bit more about seeing people who aren't, you know, I hate to say within the health and human services community, or, you know, just different perspectives of what is going on in our community, the communities, as Michael's saying. So, you know, one thought would be, is there someone like from the Aspen Foundation who might be more in tune, because they do work with their human services up and down the valleys, or you know, if we want that perspective of where and what and why those others are settling here, maybe ask Amy Marjoram from the Aspen Institute for a perspective. I mean, it's just a concept, but you know, how do we make it broad-based, and then you know, for me, very much in line somehow with what our goals already are of service provision, quality airport, open space, environment protection. Who are people whose information can match up with how well we're doing on these core focus areas of our plan?
Mm-hmm.
That would be the filter in which I would try to think about folks who could participate. The second thing I'd say is that, you know, I don't want to go through too much more brain damage than anyone else, but I've always felt we've kind of shortchanged ourselves by having a half-day, second day. It just doesn't ever really feel like enough to really wrap it up, that we've just, and I missed last year's retreat because I was sick, and so I have to apologize. Maybe it meant much better.
They had a great facility.
They had a great facilitator, and went really fast because I wasn't there. So I'd imagine we're planning on having this facilitated as well.
Well, that's another discussion. I think depending on where the board wants to go with these discussions, I may volunteer to facilitate again.
Okay, I was just wondering
Yeah.
how what he felt he needed.
I always have mixed feelings about that, because
Facilitating,
partly
you
I
wanna
like to be
participate.
part of the participation, but whenever you bring somebody in, they also
Bring
don't
their
know.
own stuff.
Exactly.
Okay, well, you think that through, but I don't want to make it that we have to cram everything in at noon and be done. If there's a little more time, is going to get us more valuable results from the retreat. We only do one a year. We don't do semi-retreats, you know, we don't do checkbacks in. And the last thing I'd say is, you know, for me, you brought a good topic up of things to be on there. I think it's affordable housing. I think that crisis is really growing, and what are those new partnerships? How do we get more effective? How do we deal with lingering problems? So I see that as really coming up as a major issue.
Hey, can I just I'm going to try a very different approach to speakers. Have we ever thought about, or have we ever utilized in the past, somebody who lived here for a long period of time and now has moved elsewhere into the valley? What are their different perspectives on community? I mean, say somebody who was a longtime local that lived up here and now is living at River Valley Ranch or Aspen Glen or Basalt proper or somewhere, you know, somebody who maybe has, just a thought, I don't really have anybody in mind right now, but maybe somebody does. That would be an interesting perspective. What are you seeing from the community you left to the community you're now in, and what's the feel of that?
I mean, what pops up in mind is like a Joe Edwards, who's in Missouri Heights, but he's gotten reactive in terms of the Mid-Valley on some issues and has a perspective, you know. So again, I just want to reach out for.
I just thought that would be an interesting perspective. Yeah. I don't know, it was
Well,
just something different.
could I ask you guys to do this, because recognizing we're going to have kind of a compressed time frame, and we want to give any speaker adequate notice and a chance to participate. Could I ask you to think about it for a day or so, and maybe by the end of business Thursday, try and shoot me some names that, if you think of them, I can try and put those together and start reaching out to folks then this week to see who might be available and such. And then we're teed up for next Tuesday, just to give an update on that. And then I'll work on an agenda that tries to incorporate what I've heard and bring that back to you next Tuesday, so we can start to beat that up. I just wanted to get a sense if we're on the right track or not.
And as far as Rachel's issue about housing, I don't disagree that it's a topic we need to talk about, but we've done housing for the whole 2 days before in the past with all the information, and it's such an in-depth, lengthy discussion. I don't know how it would just be a starter conversation we'd have as part of a retreat, or what information. I mean, that's a pretty big topic. That's a full-day retreat topic.
Well, and I think what we've been talking about in the admin team is how do we we didn't do as good a job of it this last year. I think we started about how do we keep these discussions alive throughout the year so that they flow more easily into the budget process, the retreat process, and that sort of thing. And I think one way to scope these discussions is if we focus on what are the results that we want to achieve, we can bring solutions back in a work session kind of
Specific
format. One of the things we've talked about with the department updates is we've done a process where we brought everyone in and we've talked, and there's some value in that, but what we want to do now is bring back those budget profiles and start from there and kind of talk about, do we have the right goals? Are we pursuing the right solutions? Before we go into budget planning next year, do we want to look at something different for housing and such to achieve the results? So if we can focus our retreat on what is it we want to achieve without having to figure out the solution, I think you can make that discussion a little bit more compact at the retreat level. And then we've got something as staff say, okay, now we know what we're aiming for. Let's come back and talk about
do a
what do
specific work
solutions
session.
look like and what do we need to resource them. And that way we can have an ongoing discussion throughout the year based on your priorities.
I had a thought during this whole discussion about, bringing in the broader community. And perhaps we could do something through the caucus system to invite one or two people from each caucus area to come, and we could maybe have just a town hall kind of a meeting where they can bring up any topic that's of concern to them, just to ask us questions or to bring their concerns to us that they maybe are reluctant to. They haven't had the mechanism to have just an open-ended discussion about anything that they are concerned about in their particular part of the county. But maybe we could do that also with just the selected people, but if maybe we could make it a broader group with representatives from caucuses and from some of the non-profits. There are a lot of people from Eagle and Garfield County who watch us on Grassroots TV regularly. Because they're always telling me about it. So I know that they're watching, so maybe some people from the other counties might be appropriate too, to look at the big picture of where we are, how we're doing, where we're going.
I don't think a caucus discussion would be a bad idea. I just think if you have you're going to have two totally separate groups of people, and I don't know how focused the conversation or the discussion would be. I think it's two separate.
And it would be, maybe we would want to have a caucus-oriented discussion about things, because they kind of have common issues. And then we
So
could
we've
have a
got two
separate.
really different concepts that where it started with the panel discussion. Sorry, Michael. Looking at how do we bring people to the table and talk about what is our community today to help us understand. So what is our community? What does it look like? Who are we? Maybe even who do we want to be? Kind of discussion versus more of a discussion about an evaluation of are we doing the right things well, which I think are two really different kinds of discussions to have. And I think we could have either one, but I think we can only have one successfully during the retreat. And so
It seems to me, Steve, that the caucus actually is the most connected communities that we have. They're an official part of the county, so their feedback is asked for, and their master plans are generated by them. So in terms of communication, that's probably, that's what we hope to be the best communication we have already. What I'm thinking is, there's other entities, other persons, other sort of movements that we don't have communication with, that we don't have an official relationship with, and that's what I'm concerned with. For instance, if I open Sojourner magazine or Aspen magazine, I'm not quite sure what I'm looking at. But that's so I get a feeling of it's not alienation, but it's like I've dropped into something I don't quite understand, but I think it's understandable to other people. It must be because it's printed for them. So that's what I'm trying to get at is what is this community? That's a segment of the community. It's a puzzle to me. The caucuses aren't a puzzle.
30 degrees, we start turning the guns on.
Okay, so turn the guns back off. Steve, I agree very much with Michael's thoughts there. And what you're describing to me sounded like an all caucus town hall meeting, but not a board retreat. And I do feel we receive regular letters from the caucuses discussing issues and bringing them forward, or let alone phone calls from individuals. So I think that would take it away from being a board retreat to just being a listening session of sorts. And maybe out of the retreat, that's something we decide we'd like to do.
Maybe we could do
but-
that in a regular or work session sometime down the road.
Yeah, it may be, but I also know at the same time, people like George spend tremendous amount of his personal time driving up to the Frying Pan Caucus to hear him in person, and the Redstone Caucus as a regular attendee. So I don't quite see that as the same thing. I think it's got to be focused on. And we've jumped immediately to so many other esoteric topics, but as John said at the beginning, the focus of this is in many ways going to be the successful implementation of major projects that are already on our plate and that are, our priorities from years ago, and we can't end those and jump on new ones, such as broadband, is an ongoing priority. The airport, ongoing priority. This building, ongoing priority. And a multiple set of other ones. The only thing, and I would like to comment, Patty, on you on the panel or anyone else as we think about it, is let's make sure we're thinking of people who are really going to think of Pitkin County and what a county does, what counties can do, and not just Aspen. You can get a lot of people who've moved out of Aspen, and then we hear from them for 35, 40 minutes about everything that's wrong with Aspen, everything Aspen's done wrong, everything, you know what I'm saying?
I'm thinking of county residents, not specifically city of Aspen.
I know, but if we're
residents.
looking at people who've moved down and away and why, again, I'm just saying we should think about ones who have county in mind. I'm thinking back to when we did the coffee chats with Hillary, and we'd start with like a little questionnaire and see which services you think the county provides versus the city provide. And there was just so much confusion between the roles of the two different
You mean how many
entities.
people ask you if I'm the mayor?
Yeah, or things like that, or how come you guys aren't doing this with this project? And so anyhow, that's just a throwaway comment, but if we're to have folks who've moved away and what their perspective is of the new community, I want to make sure it's not, doesn't become an angst fest with how Aspen became unaffordable to them.
We could get that from anybody who comes.
Exactly, that's what I'm saying. Okay, there we go, that's enough.
Well, that's a good point.
That's right.
So,
Well, I'll have fun putting an agenda together, and
You asked for it.
yeah, I did. No, I think I've got a good sense, though. If you guys could shoot me some recommendations on panelists, and I know Thursday's a short turnaround, but it might give you some time to percolate and think of some folks. That will give me some time to see who might be able to attend and what kind of panel could we put together. And I will work that into the agenda.
Very good. Do you have a location yet, John?
No, and the location is a little bit dependent, and the other thing that, just in getting some individual feedback from you guys is maybe keeping it smaller this year to more the board. The limelight is not available on these dates, and so we're still working on a location, but we may look at, a little bit smaller venue, unless the board, wants to, as we have traditionally done, bring the organization in for these discussions.
Like the
But
GAF?
we've talked, and I think department heads and section leaders could go either way at this point. And what's more important is that you guys have a robust discussion and give us some idea where you want to go.
Maybe you could take us up to a hut trip.
I could use the practice, I understand. I don't know which would be harder.
I want to be pulled off the
Yeah.
I was thinking the GAF or the Inn at Aspen, rather than.
Yeah, so we've got some options right now, and if we keep it small, it's easier.
Yeah, a last thought is if we're changing formats for this year, it doesn't mean we have to do it this way every year.
That's right.
And to do it a little differently this year, I can see that. But I think it'd be valuable maybe to do a little homework if we're not asking top staff to come in and ask them, what do they see as the 3 top issues for themselves for the coming year? And have it in a memo form, so it's a little bit of background for us, but it's not, taking half or more of somebody's day. Just bear with us.
Okay. What I suggest doing now, we do a 5-minute break, and then we'll go to the X Games discussion, because we have so many people here for that discussion right now.
Or do we just, since they're all sitting here, I don't have a problem, we got all the X Games
Or
folks
we could
here.
just do the X Games thing now and then do a break after. What is the board's? Sure.
I'd rather, since they're all here.
Okay,
I did have a couple more things.
so who's, Mike, you have your name on it, on our agenda, but I don't know, combination of people to lead the discussion on that?
Yeah, yep.
So this is a X Games update is what we have listed.
And Mike Kramer with PitkinCounty planning staff, and with me here is Vanessa Anthes from ESPN and X Games, and then also, obviously, we got Alex in his uniform back here with us. And I updated you folks about a month ago about the concerts, and we had talked about that. And if you remember back in September, we had a meeting, and we X Games disclosed they like to have some concerts, and we had some concerns about time frames and when they were going to happen, and et cetera. And Vanessa has appropriately made the adjustments, and I updated you last, I think it was in November, maybe it was even early December about that. But this is open discussion in case we want to ask Vanessa any more questions. From special event permit side, we have their application in, we have a draft permit ready to go. We are primed to issue that permit with a couple things pending. For example, building inspections for the scaffolding and the stage that are out there. Alex is still meeting with his incident management team to hone in on the intricacies of the plan for that. And that's about it. So if we wanted to ask Vanessa or Alex or me and my department any questions, we can try and answer them for the board.
Patty?
Yeah, I got a call when we were having the discussion about the concerts from a gentleman, and then, of course, my phone crashed and then took away the guy's phone number. But he's in the West Buttermilk neighborhood that's adjacent to the Sloke side, and he had some issues with parking and trespassing. So if we could, I don't know how much the sheriffs actually patrol that, but he was very concerned, and he's at the lower levels of that side of West Buttermilk, so.
Sure. What I can say is that in addition to staffing for the event itself, we're also augmenting our patrol staff as well, because we've identified that as an area that
Perfect.
in the past not that we've forgotten, but we just have in the past just done normal staffing, and we're going to increase that to add some additional people on the road to assist the state patrol, but also to have people available
That'd be great
to
if somebody could
respond to.
just do a routine loop around there and
Sure.
just check in. I'm sure that gentleman would be very happy.
Yeah, I'll put that on our list for sure.
There also is the parking on, just opposite all the parking lots on the county road. There's trucks parked there, then people park there, and then God knows what happens. And there's also an access road to the airport, which doesn't have a gate on it.
Right.
It just says, don't go down here, but I've seen people go down there. So that's an area of concern, I think, in terms of traffic control and what's going on there.
Absolutely. In the past, I believe that access road actually also accesses the West Buttermilk water pump facility that's managed by Beach Resource, and we've reached out to them in the past to, if they try to get in there to plow it or they see someone parked there, they have our phone number in the command post to let us know. We can send a patrol guy over there to deal with that.
Right, but it gets close to the airport, and I think we want to, for me, it's a security question. People will take advantage of large events, because you won't notice them.
Oh, I see what you mean, yeah.
Right, and we can certainly make sure that's on our patrol list of functions that they're supposed to be paying attention to, is increased security patrols around the perimeter fence of the airport.
I don't really have any questions. You've always heard my concerns about crowd control, making sure no one's going to get crushed if there's a stampede for some celebrity up front or something like that, maintaining those safety corridors. You know, you've done an excellent job of improving the venue and improving the event every year. And so has our staff and Sheriff's Office coordinating for this. And so I'm looking forward to a successful and happy event. And who are the big artists you're bringing in this year for?
So, talent this year, Thursday show, it's a doubleheader of Run the Jewels and Nas. Friday is 21 Pilots.
Oh, yeah.
Appropriate at the airport.
Saturday is DJ Snake, and then Dead Mouse, and then Sunday is Kygo.
Yeah. See, that's like me reading Westward and looking at the fans in Paramount Theater. I'm like, I don't know any of these people. Where's the Steve Miller band?
Rachel, I'm so sorry. I recognize two of them.
Is it one group, Snake and Dead Brat or Dead Mouse or?
So DJ Snake is playing the Saturday afternoon show. That concert is 4:30 to 6, and
He's
then
his
Dead
own
Mouse
person.
is 9:30 to 11. So
They kind of go hand in hand though, don't they?
You don't want to see him with Eka Mouse at the same time. They do that.
Nice.
I'm thinking it's got to be an interesting name for a group.
Vanessa, could you go through the whole concert schedule on each of the days, what those
The time.
start,
The
the times for the,
So the concert time, so Thursday's show, Run the Jewel, it's again a double, so it's one ticket for Thursday. And Run the Jewels is 8 to 9, and then Nas is 9:30 to 10:30. Friday, 21 Pilots is 9:30 to 10:45. Saturday, DJ Snake is 9:30 to 6. Dead Mouse is 9:30 to 11. And then Sunday, Kygo is 3:30 to 5.
Okay, and the 11 o'clock conforms with the time with the airport where we don't take any more commercial. That was the standard we'd set. Okay.
Yeah, we've submitted a noise variance for the concerts overall for the weekend.
Yep, which has been approved.
And clarification, the final approval of the event permit will come through staff, right?
That's correct, yeah. There was one more thing I wanted to add, Steve, since we have our fire marshal in the room too. And that was a few weeks ago, Vanessa contacted us about potentially doing some fireworks at X Games during the concerts. And we spoke with her, and they've kind of honed in on what these fireworks are, and I just wanted to update the board that these fireworks that are proposed are what are considered close proximity fireworks, as I understand.
Oh, God.
Yeah, and they are fireworks that are appropriate for the distances and for the proximity to the stage and the people. They have no report or noise to them. They're just basically flares. And Vanessa contacted Parker and I to talk about these. And they're running a permit through Parker and the fire department, but I just want to let the board know there was going to be some light displays of this sort with no noise.
Yeah, so think of like stage pyrotechnics
say, like,
that you
it
see
cuts
on
us
an
off.
indoor amphitheater concert stage, non-concussive, indoor permitted type things, not the typical winter school stuff you'll see here soon.
It's visual effect only.
so would that be in the concert venue?
That's at the stage on Sunday for the Kygo show.
Okay.
Oh, poor Dead
And
Snake.
it probably is overly cautious, but I would check with the airport as well to make sure they don't have concerns with unusual lighting at night.
We typically do, but I can make a note of that.
And
for
we've
sure.
had conversations and reached out to them regarding this specifically
Yeah.
already.
Oh, good.
Michael?
So it's important to me, Vanessa, that the package be presented to the commission at an early date. And that would include, pyrotechnics. Because, what are we going to say now? I mean, this is, it's going. So it's important for ESPN and yourself to come to us early, to present a package, and to try to stick to that package. Because you've had plenty of opportunity to ask for pyrotechnics from the very beginning. And so how many weeks till X Games? Is it 3 weeks? 2 weeks? I just want you to relay that.
No, and we definitely try to respect timelines and deadlines as much as possible. Unfortunately, situations like this with fans and talent and writers and all different kind of behind-the-scenes things kind of come into play. We are going through the fireworks permit and trying to make sure all appropriate rules and regulations are followed. in the 30-day, I guess, timeline that's required for that, with submitting it in December and kind of getting that through. But again, we'll always try to push to get you as much as we can.
But
in
you
October.
see, here's the problem. The fire department's going to approve these based on safety, primarily. But we have a community that we report to. And that community is local, around the venue itself, and countywide. And so at a 2-week notice that there's going to be pyrotechnics on the stage, the Parker, that's fine. But how do we get that word to the larger community? That's difficult for us to do. So that's what I'm asking you to consider, is that even though there's very specific safety regulations that you can meet, the community awareness, you can't meet and we can't meet within 2 weeks.
Part of the application, we will be adhering to the ads that are required to go in all the papers, so that will help with the
But
community
the community needs more than 2 weeks' notice, Vanessa. This is a large event that the community has accommodated graciously, but there's a limit, it seems to me, to the community's tolerance for this size event. So the courteous thing to do is to put it in a package at the beginning of the process and present the entire package to the county. That's all I'm saying.
We will continue to try and get you as much information as we can as early as possible.
Right, thank you.
And can I add to that, since I was part of the fireworks process? We've had quite a bit of discussion, so that there was no package available until recently on what the fireworks were going to be. We went back and forth on what was acceptable, what we would see as safe, and what we wouldn't. So I don't think ESPN had an idea of what direction until we had a number of conversations. So they are adhering to our fireworks policy, and then from there, once I sign it, which I have signed it, it goes to John Peacock, it goes to Joe DeSalvo, it also goes to city manager as well as the police chief. So it makes its rounds through the other organizations after once I look at the safety side of it.
But understand, Parker, I'm asking for those rounds to occur in July.
I don't think they knew that.
I know they didn't. I know that. It's just aspirational that I think from my point of view that the county would like to know in July everything that's involved in the event. And that's a reasonable request, it seems to me, because it gives us time to make those rounds and to end up here without any last minute approvals. Because a last minute approval, is it really an approval, or are we just trying to get out of the way of the steamroller? So.
I understand what you're saying, Michael, and I think what the Special Events Committee can do is maybe have earlier conversations with ESPN and get those newer things that they're flushing out with the concerts and fireworks and other things that happen as they change, and get that earlier into the permit application so that we can present it to the board. And we can certainly work on doing that.
Rachel?
Yeah, I'll just say I agree with Michael's point, and it often comes from other events that may be very last minute on things, and we feel like, hey, we can't say no because we'll kill this event. But I just have to say I think July might be a little unrealistic. That you don't even know which bands are available by then, or how can you book them, and so. But I think that at the level he's asking that we conceptually talk about these things and meet earlier makes a lot of sense. But I'm not hard and fast on the July.
No, and I'm not either, Rachel,
Okay.
and I don't think I'm not interested in knowing the names.
I know, you said it's aspirational.
I'm not interested in knowing the names of the bands. It's really about a package of community events and when they're going to begin and when they're going to end and how they impact the community. But the names of people, I'm not concerned with. So.
One, in terms of the fireworks, there have been problems with fireworks, quote unquote, being the loud explosions that have nothing to do with fireworks, and people's dogs freaked out and got injured, people's horses freaked out and got injured. And I hope there are none of those, the loud
No, these are non-compressible.
explosion things that they call them fireworks, but it's just a noise-making thing, and that actually caused problems to the community, whereas the actual flares and fireworks going up in the air didn't cause that kind of problem. So that's the kind of thing, it's, you know, a couple weeks before now, and you probably have the fireworks all on order and stuff lined up, but if there's that sort of a thing, that would happen with us being unaware of it.
Yeah, and just to clarify too, our initial notice that that ESPN wanted to do fireworks, you know, we had a conversation about them and the tolerance level for exactly what you're talking about, Steve. And Vanessa and ESPN have clarified that these are the non-concussive, non-noise fireworks, and they're only the fireworks that basically shoot up and make a light show.
Mm-hmm.
And I think that definitely helps accommodate some of the community impacts that we're talking about with noise. These will be the non-noise fireworks.
Mm-hmm. Penny?
I just say it looks pretty cool driving by. That pile of snow they got out there that they're moving around is pretty awesome. Yeah, and it's a great way for us to have a slow melt off and keep that water on the mountain for a while. So thank you.
Do you have any questions for us?
No questions, just again, thank you, you know, to the county, the city, all the public agencies. We know we're quite the impact, and just appreciate everyone's open arms to us, and, you know, hopefully, you know, the relationship can continue for many, many years to come, and thanks for letting us call Aspen home for so long.
How many years do we have left on the contract?
After this, I believe it's 3.
Yeah.
And I look forward to seeing you out there.
Great, thanks.
And Steve, I know you're planning a break. We do have 2 other open discussion items, I think, and one of which would involve, I think, Alex, Michael, and Cindy. I don't know if you want to go into that or if you guys need the break.
Let's take a break. I mean,
Yeah.
otherwise we just keep on.
Yeah, we're 45 minutes past turn. We haven't had a break since 1 o'clock.
Thank you.
Okay, welcome back to the Board of County Commissioners meeting on January 12th. And we have a couple more items with the planning department, so Mike and Cindy and Alex.
Yeah, thanks, Steve. These are just 2 update items that I wanted to bring to the attention of the board and make you aware of what we're dealing with. The first one is a Fiat film shoot, and we had an application that was submitted last week. And yeah, Fiat cars, yeah, Fiat cars. And Alex and I met last week to talk about it. This is, in the scope of things, a very small film shoot. They're proposing to have 1 Fiat car and about 15 people and 3 other cars to maneuver around in a Winnebago to keep people warm while they're doing this. The location of this is Castle Creek Road, and they're proposing to shoot from 7 a.m. To 11 a.m., so it's a relatively short time. There's 2 locations they're looking at. One is the first bridge on Castle Creek Road. As you kind of get past that, where the big cut is in the road on the right-hand side, there's the bridge and a little pull-off there that people utilize, and it's actually a really good spot to have a staging for a small film shoot like this. And then the other spot is I'd like to use a straightaway just north of Ashcroft by the old Elk Mountain Lodge. There's a straightaway section there that is also good. There's good sight distances there, and then parking in an off-street parking area. And we've referred it out. Our sheriff's office, our county engineer has been referred on it. And then we also referred the Castle Creek Caucus, who is an up-and-coming caucus. And they have a caucus representative who we work with, and they're trying to formalize their caucus. He sent it along to all the caucus members who live in the Caucus Creek, in the Castle Creek Valley, and we had significant public comment against this film shoot. And about 15 or 16 emails in writing saying that they are opposed and don't want this film shoot. And I just wanted to bring it to the attention of the board that we've worked out the safety issues. We have a formal permit applied for. We're primed to issue a permit for it, but there are significant citizens in the Castle Creek Valley that don't want it. And if there was any reason that maybe you felt in a community aspect or perspective to not issue this permit, we certainly don't have to. And this is a permit that could be issued, but I wanted to update the board that this was going on and that you may hear about it or see about it too.
Mike, can you just again say the dates and the time?
Sure. The application was submitted last week, and they're proposing the film shoot for tomorrow, Wednesday, January 13th, and the proposed times are from 7 a.m. to 11 a.m. Yeah.
Is Fiat, is it part of the Gay Ski Week?
Actually, they did say that. They wanted to film the commercial and have it ready to market for Gay Ski Week.
I don't know if they're part of the sponsorship. I do know there's another use of a Fiat and some old Christmas trees, and it's a bright orange Fiat. I've even heard to the details. And I understand the concerns of the caucus, and but it's a very short window. It's not like they're closing the road all day. That we know that some film shoots can, take repeated trips up and down a great length and stretch of our county roads. So, and I think if we really looked at the concerns, the safety concerns, the line of sight on the road uses, and off-road parking, so that the traveling residents up in the constituency up and down that road is not, sitting in their cars in the cold for great periods of time. I'm not necessarily opposed to letting it move forward.
And if there's one thing I could add too, they did actually propose to close Castle Creek Road in the initial application, and we, our special event committee staff, said that you certainly cannot close the road, and they were totally okay with that too. They
Okay.
can work around that requirement.
I think that would be a definite no for the residents that live up there.
Will the sheriff department have a presence up there just to make sure there's no safety concerns?
We certainly can. We have the staff tomorrow to do it. They had asked for 2 dedicated deputies to assist them in closing the road. And in my experience, in my time as the Director of Operations for the Sheriff's Office, we've never done that. We have never provided deputies. I'm not going to say never. In my time, we have not provided deputies to close a road for a film shoot or a photo shoot like this. But we can have a presence up there along the road to just mitigate any safety impacts.
I think that'd be a good idea.
Michael?
Could you ask me out to put this in July? And
I agree.
I'm perfectly willing to listen to the Castle Creek Caucus, and if they don't want it, they don't want it. That's fine. That's the way I feel. I mean, if it happened in Woody Creek in my caucus area, and the caucus said no, I'd respect that. So I'll respect the Castle Creek Caucus also.
Is there a formal Castle Creek Caucus?
Not yet.
So,
Maybe this will inspire them.
Yeah.
We discussed, when we talked about special event permits and stuff, the challenge with filming in particularly, because it is a really quick turnaround business. They'll decide, we need this, the colors are perfect, we want that location, and the permits never really come in with a lot of good timing. I would think that if there was time, and if there was an active caucus body, that, there was a caucus, there was a caucus area, there are residents with concerns there, clearly. But if it was a functioning caucus, this would have been presented at some level before the caucus and maybe get some pros and cons. And, because you get a few more folks who are saying, oh, I know someone on the production crew, and I know someone who's doing the catering, and this is actually a good economic thing for a very limited 4-hour window, yet for other residents in our valley who have jobs in different professions. And so, to that end, I could allow this to go forward. It's not a multiple day, it's not a road closure, it's not like filming a movie and it's going to be endless impacts. But I fully agree with the concept of having one of your sheriff's deputies up there. I don't think it has to be 2, but if, they find that snow's a little deeper than they thought it was or whatever when they're trying to set their cameras up and how to stay out of the road and stay safe, I think it's going to be really important. And I wanted to make sure the one lower bridge you're describing, that's not the area near that avalanche zone that we have on Castle Creek?
It's just south of that, actually.
Just south of that,
Yep.
okay. So they
It's a
are
great
aware that
pull-off
there's an
spot.
avalanche zone nearby. And I don't want to linger there too long.
Well, it's all within an avalanche zone. It's not, it's south of the sign, but that area is defined as an avalanche zone entirely.
Yeah. So it's proceed at your own risk. Yeah.
That's why they're using a bright orange.
Yeah.
So,
At least rumor has it.
having participated in a couple of photo shoots myself in the valley, they can be very interesting. They can put a lot of money into the valley, actually, and it seems like a short notice thing to me, though, that would have been nice to hear about it earlier than one day ahead of time. But the fact that the traffic can be off of the road in safe places and the road isn't being closed, as long as we don't have like really inclement weather with a blizzard going on or something that would make it an unsafe situation, I'm perfectly all right with it going on.
What's the weather supposed to
So,
do?
are they going to have flaggers, road flaggers there? Is that part of the safety above and below to let people know something's going on? How are they notifying people driving 35, 45 miles an hour that something's right around the corner?
We could ask them to have flaggers. We didn't require it at this point because of the good sight distance in some of those sections. But the idea is that the car goes the speed limit, which we've required. And
I was talking about the other people.
Yeah, right. And then they're going to have a camera station and they would watch it go by. But that's a good point. Yeah, we could certainly tell them to designate someone and say, slow down in this area, or the oncoming traffic, be aware that there's
A little bit
people
of
here.
orange.
Like they do for a bike race. Bike race ahead. Photo
good
shoot
point.
ahead.
So
That's a good segue.
So this is a work session, so we're giving direction, so 4 commissioners are saying it's okay and 1 commissioner is saying it's not okay. Is that what my understanding is?
Yeah, so this is, it's an administrative approval, and so we're asking for direction from the board to guide the administrative action for ComDev, and that is, you know, to do that check-in, Michael, yeah, what I'm hearing is that 1 commissioner, you would support the caucus position to deny, and we have 4 that would support allowing it to go based on the minimal impact.
Can I ask you, after the fact, for just a little quick memo or something to let us know how it went?
Yeah.
So if there are any issues, we can use it for future information.
I can do that.
Thank you. Just a little blurb.
That was the easy one.
Yeah, and before we get into this next one, because this next one I think could generate quite a bit of conversation, I think we may have a shorter meeting tomorrow, so it'd be good for us to maybe introduce this, kind of see where the discussion's going to go, and if it looks like it's going to be lengthy, maybe we can bring it back into open discussion tomorrow, so we can move forward with our building project discussion too. These are 2 that just popped up on us, and so go ahead, guys.
Thanks, John. So planning staff has been in conversations with a major bike event, Colorado bike event, that is looking to come through Aspen and PitkinCounty in early to mid-June, just the weekend before Food and Wine. And we are in conversations with them right now. We have not had an application submitted, but it was so significant, I asked the promoter to put something in writing so that we could start preliminary discussions about it. And the idea is that this bike event would be 3 days, and it would be a Saturday, Sunday, Monday. And just a quick outline of what this would be. The first day, the bike event is proposing like a VIP ride of about 50 people. And it would be on county roads throughout the county, and we do those all the time, and that really wasn't too much of an issue. The second day, they are proposing that 2,000 people do a county road ride on, that would be Sunday. And they would use a route, it's not obviously been determined because we're just talking about this stuff, but it would be like a Castle Maroon Creek ride, or a McLean Flats, Owl Creek, Lower River Road ride of an approximate number of about 2,000 people. They would end in Aspen, and then on Sunday, they would get up and prepare the bikes, and they would bike over Independence Pass into Lake County then, and onward to whatever destination they're going to. So the not that, all three of them don't have impacts, but of the three, the first day of the VIP ride and the last day of them leaving the county pose much less of an issue than the Sunday 2,000 person ride on county roads. Alex and I had a chance to talk about this last week, and using the email that this gentleman has provided me. And 2,000 cyclists is a lot, and that would be, minus the Pro Cycling Challenge, would be the largest bike event that the county would have staying overnight like this and having a county road ride. 2,000 people also obviously generates a lot of impacts to county roads, and with that number of people effectively is a road closure. And I wanted to bring it to the attention of the board that they are primed to submit this application to us. And I don't know if there's a decision point right now because we don't even have an application in hand to present to you. But this is coming, and they would like to submit for this. And we would like the commissioners to be aware of it so that you can make the final decisions on road closures and impacts and things like that.
So on Saturday, you're talking 2,000 people lined up somewhere in Aspen, riding up possibly riding up Castle Creek, riding up and down Maroon Creek, and then somehow getting back from there. I can't imagine 2,000 people on the bike trail going across the Castle Creek Bridge on the sidewalk. But that's kind of the tentative plan
That's what they're verbally proposing at this point. Right
and the
now.
other option would be utilizing Owl Creek, McLean Flats, or Lower River Road, that side of the.
Somewhere there, yeah. So in our response to them saying, "Wow, that's a lot of bikers to have on Castle Maroon. That's a road closure." Their response was, "Well, what if we do a loop in the county somewhere?" And that too is a
huge road closure.
A road closure too.
Everything's a road closure.
And then going up over Independence Pass with 2,000 bikes, that would not be a road closure?
I think that'd be up to the state patrol since it's a state highway.
That's another question I think there'll be.
It's another facet of
Yeah.
the conversation.
Who are these 2,000 people? I mean, seriously, I mean, are they locals, or are they part of a group? Is it a competitive event? Is it a social event?
Corporate event?
What is it?
Yeah. To be honest with you, Michael, I don't know who the people are, because I think what it is they open it up for people to pay an admission fee and then come and do this ride. It's been represented to me in a conversation with this guy that it's not competitive. It's not a timed, like a time trial or anything. It's a ride. A tour, yeah. A tour. That's
It's a tour of the state.
And what's the title of this event?
Tour of the state.
So there's no title of the event? Wow.
Well,
You know, I'm grateful for the heads up, but I think, I mean, I would need a lot more information. George?
I guess our question of you is, are you, should we give back information that there's just no way we would want to close roads for an event such as this? If we can give that information back, then, we have a little bit of direction. If in fact, you want to know more about it, we can come back tomorrow and talk to you at your open discussion then. If there's a possibility you might want to. In the past, we've heard that such large events, you weren't interested in road closures, so.
Well, just given our last discussion on a little Fiat photo shoot, I suspect that when you send this out to the Maroon Creek Caucus, the Castle Creek Caucus, the Woody Creek Caucus, the Emma Caucus, and anybody else out there, I'm going to guess that they're going to say, we're not interested. On a weekend in June, out of 8 weekends, here's one weekend. The bells are going, the Raptor's running up, then for me, it's not going to work.
What if they go single file?
Slowly.
Well, it's kind
That's
of like
4
riding
days
up,
of
they can ride up 82 with all of us. We already are single file.
Yeah, let them ride up 82.
Instead of in a car, we're going to be in a bike.
Well, I think we need to look at more information and see who the organizers are. And maybe they're just throwing out the fattest number, and it's really going to be 1,000, which is still a lot. And we've closed in the past Maroon and Castle for
Fundraiser
right,
for Susan
yeah,
Komen.
for the Susan Komen, right?
Yeah.
But that, I mean,
I'm not even sure if that was a full closure. I just know I read some angry people at my station.
I'm curious if there are any local riders involved, or is it all people coming in from elsewhere? Where are they going to park the 500 to 1,000 to 2,000 cars with the bike racks on them to bring their bikes here? Where are they staying? There's a lot of those kind of questions that I'd want to know. You know, it might be a huge economic boost to the community. It might be a total economic bust to the communities.
How many people
There's a lot
ride
of
the
things to
Rockies?
weigh.
2,000 people do ride the Rockies? So they're gonna, we don't know, maybe they're gonna stage it like that with the plan like to ride the Rockies and ride the Rockies.
Yeah, but they're moving through. They're not staying in the community for days on end.
Right, well, these guys are gonna be coming in one day, staying that night, staying Saturday night and flying out. Whatever they do out Sunday.
Rachel?
Thanks. Yeah, this reminded me, I couldn't remember the fellow's name or whatever it was, but the spin head proposal from a few years ago, and they
Good
kept
memory.
approaching the city and the county, and I hope this isn't just a new name for the same effort, because they wanted, you know, camping across Wagner Park and up at the high school and all sorts of things like that. So I was thinking too, well, is this a camp out bike thing, or is it a, you know, are they renting hotel rooms? And that's a big difference to me. But you also said it's a 3-day event here. Is it part of a 10-day event across Colorado?
Yes.
And so that people will be coming from all across the country to bicycle Colorado.
Like ride the Rockies.
Like ride the Rockies, yeah. You know, it just sounds like too much impact to me. You know, it really just does. 2,000 bikes is massive. But I think we need to maybe talk with, if you haven't already, Mike, the ACRA to see have they been trying to coordinate with them, or is this a group someone has been trying to bring in and we didn't know that?
Sure.
You know, without checking with us and yeah.
And the city.
And the city, you know, the city's doing a lot to promote bicycling, and so I just, I don't know if they're endorsing it or have been soliciting it or what, but it just doesn't sound viable to me with the road closures that would be necessary.
If it was a Ride the Rockies sort of an event where they come in one day, they camp or stay wherever, and then they ride out the next day and over Independence, the impact on the community would be a whole lot less. The fact that they're staying, they want to be here because they all want to see the maroon bells
Yeah.
or whatever, is like, I don't think we need that.
I mean, if you think about it, the last time we have supported road closures, rolling closures, it was under the auspices of getting an awful lot of national television promotion and advertising, and that was the community benefit, you know, that, and I just don't see that with this event. And not enough to inconvenience our people and put our sheriff's office out.
Michael?
Well, the difficulty, I think, for me at least, is to say I'm not interested, and yet we're supposed to have a fair hearing, essentially, of what's proposed. Most of this has been questions like, how big is it? You know, who's sponsored? So, my feeling would be you take their application and you say, listen, the commissioners on a preliminary basis were skeptical because of the size of your thing. However, we will look at your detailed application for a special event and consider it on that basis and go from
That's
there.
exactly what we plan on doing.
Yeah.
Because we just needed a kind of a temperature reading from you about the road closures. I think we got it.
And to help too, my conversation with the gentleman this morning was that go ahead and submit. We'll convene the special event committee, make a recommendation, and then final decision would be by the Board of County Commissioners. And he understood all that too. The time frame was a little bit tight because of his desire to announce to, you know, what the route is and,
We know that one.
all those things that go along with having a bike event.
Well, as part of that, again, as I said earlier, we would want to inform the caucuses that would be involved and give them enough time to respond back to provide their feedback and input.
You know, the difficulty for me is that you have a community that you live in and that you treasure and that you've contributed to in many ways. And then you have people who see that community and say, well, that community is actually a commodity, and I can make money from that commodity. And that's where I have difficulty, whether it's the Chrysler Corporation promoting their Fiat, or this particular person who's unnamed as of yet, seeking to make my community into a commodity that he can cash in on. That's the difficulty that I have. So where's our tolerance for that commodity making of this community? I'm not sure. So Castle Creek people say not one goddamn Fiat, and we say, you know, 2,000 people. That's you know, maybe that's 1,000 people too many. So I don't know where we stand on these things.
We look forward to seeing this event permit application. We eagerly look forward to seeing it.
And I have one more quick. Rachel had asked about checking into the Colorado Climate Future Coalition, which is a coalition of, hopefully, of communities that will look at legislation in the state, basically enabling legislation or legislation that's proposed, and review it for energy efficiency and building codes, energy codes, that sort of thing, and help work together as a coalition or a collaborative that would then have a little bit more say before the state legislature on some of the issues. And Rachel, I did some research, and there are some other organizations in the state. So there's maybe a little bit of duplication here where other organizations, Colorado Climate Action, things like that, may have some of this going on. But as far as I could find out from other community members such as Aspen, people who have been very involved in the climate change issues, this is the only one that is made up of county and city jurisdictions, and it may actually have a little bit more organization behind it. The idea is that the first year they would just be organizing and trying to decide what legislation to look at and all of that, and the second year be a little bit more active, get a lobbyist, and actually do some work in the state legislature. The request right now, it would be for a community our size, if we wanted to be a base member, $5,000, or a core member, $10,000. I spoke with a gentleman who's heading this up for Boulder, and he says Fort Collins is already looking at joining, Aspen is looking at joining. Boy, there's another community, I can't remember right now. But there's a group of people who are jurisdictions that are looking to use this as a way to promote their goals for energy efficiency. So with the research I've done, I would say this would meet your goals and help further your goals for working on climate change issues and doing that through the codes that you have, as well as some overall education in the state.
So this will be a group that would act as a lobbyist for climate change legislation for the state.
And there would be membership, obviously, by the various groups that choose to join.
And is it fairly new organization?
They're just starting it up.
It's starting right now.
So they're asking, would we like to become part of?
Would we like to be a member? And it would be processed through an already existing nonprofit, the Rocky Mountain Climate Group, Rocky Mountain Climate Org.
So, but we don't know the makeup and the background of the people involved and their experience and their.
Well, it's just a request right now
Yeah.
by staff people such as myself to get a group together, and then the group would be defined as the membership decided.
So we don't know if there's industry involved or at this point?
At this point, it would be jurisdictions, city, municipal, and.
Lobbying for issues specific to those.
Right.
Well, you know, if we have further questions, they have said, you know, Boulder approached us basically and said they would be happy to give a more formal presentation and tell us what it's about and what we'd like to do if we'd like to consider it further. I think we know Boulder in general is very proactive and, you know, they're in the course of creating their own utility so they can stop buying coal and direct more, you know, green resources towards their grid. And they've just kind of noticed that there really doesn't seem to be a push through legislative action on that area. You know, there's no consistency. There may be individuals who care about it, kind of groups, but no one whose sole focus it is to how do Colorado contribute to our new climate action goals coming out of Paris. How do we, you know, start to line these things up instead of just being verbal, you know, nice lines. And I don't know that this is the right way to go or not. It's, you know, we watch every penny here and I want to make sure that it's effective. Also, you know, we'd need a designee to that and someone to participate. But they did ask that I bring it forward to the board and discuss it. And I know, Steve, climate's always been a key issue for you and for the rest of the board. But how do we do more than what our next discussion is going to be about how much should go into our building for energy efficiency? How do we do more to advance the effort?
And I do know that the city of Aspen is going to pass, or they're asked to pass a resolution soon because they will be joining.
And so maybe the recommendation at this point is, you know, staff would say, yes, we should explore it more. Maybe we should invite a representative from the group to come up to a work session. The board can make a decision at that point.
Or also ask if there's other ways to kind of ramp into it, and, you know, would a $1,500 contribution that we're an associate member or something, and then as we see it taking form and shape, consider greater contributions. I don't know, but that might be an option as well. I'm sure, similar like the I-70 Coalition, they were happy enough to have Pitkin County's name involved in active participation, as opposed to whether it's all about the dollar.
Well, maybe there wouldn't be any money spent until the concept's more formed. Yeah, something like that.
I just want to, I don't have a problem looking into it more, but the issue of redundancy, we're seeing that with so many of our environmental movements and actions, and we saw that with the Bark Beetle Cooperative, and we're looking at that now. What are we overlapping our services, and, you know, could our money be better spent in just concentrating on one organization that's already established and getting an arm of that organization that's a lobbying arm, rather than creating a whole nother gamut and a whole nother organization. So there's some opportunities I think we need to.
Well, I asked those questions, and according to people that really know, no, there's nothing like this.
But could it be an arm of something that already exists?
The thing is that once you cross your science research and your grants and things like that as a nonprofit here, with lobbying activities here, you know.
But they're associated with a nonprofit, didn't you say?
They're just going to use.
I'm wondering if you guys need more. I'm worried we're going to short-term change our next discussion at this point.
Yeah, I definitely would want to look into it further.
I think we probably need to have somebody come.
I could see it, you know, bringing that kind of legislation forward in Colorado in today's climate, where half of the state is into energy extraction kind of industries. It'd be a huge, partisan kind of political issue potentially, but still worth. I mean, it's such a huge problem facing the whole world, and it's worth pursuing it, at least to find out more about it.
Right.
You know.
I'll see if I can get someone to come and talk with us. Thank you.
Thanks. Thank you. Thanks for checking that out, Cindy.
Yeah, no problem.
So our facilities project discussion on sustainability and, Dan, I apologize, we're had a real busy agenda today and sorry to be running late on it. I hope it doesn't cause you any problems.
No, no worries.
One second here as So while I'm booting up, Dave Detweiler, representing the Facilities Department. We have Dan Richardson from Schmeezer Gordon Meyer, who is our Sustainability and Commissioning Consultant for the new project. So his role is to both advise us on some of the sustainability options that we have available, to stay on our design team as we start to design things, to represent. He works directly for Pitkin County so that he can 100% represent our interests and kind of cut through and make sure our team is really focused on meeting our needs.
What does commissioning mean, Dave?
Commissioning means monitoring as we get into construction, as we're finishing design and getting into construction. You can probably answer this way better than I am. I don't know why I'm answering. Why don't you answer it? I'm like the expert and I'm going to answer for him.
It's third-party verification of the performance of the building. So it's become more and more standard in the industry, required by the programs, and it's a third party that oversees not only the design but the construction of the performance systems to make sure they're performing the way the owners intended them to, which is sometimes different than what's designed or what the contractor thinks should be built. And that's why commissioning exists.
So you set standards, and then the standards, you make sure those standards are met.
I wouldn't say we set the standards. The owner sets the standards.
Yeah, but you undertake whatever standards are set,
yeah,
and you make sure that they are in effect.
And yep, they meet your intent. Yep.
And at the end of the day, it helps to not have the finger pointing that the contractor says it was the architect's problem, and the architect says it was the contractor's problem. He's our guy that I go, hey, you were supposed to solve all that, and make sure that we didn't get to that, because that is a real problem that we found in the industry, which is why, you know, firms like Dan's came into being. There are a lot of companies that do this work now, because their systems get really complex to try to do some of the things that we're going to talk to you about today in terms of really getting efficient systems that really maximize, you know, they're highly electronic, they're computer based, there's lots of things that can go wrong if people aren't understanding what the design documents say and able to implement it and being watched while they implement it. These companies make sure, hey guys, I know you think that's what that says, but that's not really what that says, and let's get together and make sure it works right before we get to the end and it's a mess.
So is the period of time a year after the finished construction or something like that to make sure that those systems are in operation? Because you can't possibly know once the building is finished how it performs until a later.
It's both. It's both. The process really starts during the design as we're designing things. And we can actually have a whole nother kind of session on that piece of it, because I know you guys are running tough on time. And really what we want to focus on today is some of that setting the standard sort of thing that you were hitting on. That really our goal today is to talk about some of the sustainability options that we might put into the project and what the cost benefit of some of those are. And then we'd love to come back and talk more about the commissioning piece of it, which is really the implementation of some of those and the monitoring of those long term. But can I get your okay to go to the former just to try to get you out of here?
I was just trying to get information, so.
Yeah.
George?
So when you talk about the integrated design team, Dan, I mean, that term I've got familiar with because that's what RMI used in terms of how they put forth their facility. So they brought in the energy expert right at the beginning, tied them in with the architects, with the builders, with the subs. So everyone has a vested interest. And as it was stated, that if I'm the plumber and I'm running behind, then the electrician's just going to have to deal with it. So it's everyone's working together as a team from the get-go.
And RMI took it a step further and said, you are all going to have skin in the game, that we're going to achieve this performance or you won't earn 100% of your fee. So that's sort of the cutting edge in terms of the design agreement. Yeah.
And that is a model that is used, but I would argue is not the right model for every project and for every client and for every condition. That is not what we're doing. We don't have our subcontractors having some profit connection to PitkinCounty and to all the other design team members. What Dan's firm really is trying to do is be that expert extra set of eyes that can monitor what our design team and there's decisions we can make that impact those things, sometimes inadvertently, sometimes purposeful, in terms of just let's just add another set of lights in that room, and that can have a big ripple effect. But it's another set of eyes that can help make sure that we get to the goals that we're going to try to establish here today.
Patty?
Yeah, and I think we need to move forward with the discussion, but I want to always keep in mind the cost effectiveness of having one more consultant, one more person on the team. And are we going to be that involved with our energy efficiencies that we feel there's an end of the day benefit? I think that needs to be brought into the picture, because we're looking at investing X amount of dollars to what end result, and could we better utilize funds? Because we don't have the luxury of an unlimited budget.
Correct.
And I'll make
Yeah. To be clear, Dan's firm has already been retained and is already working on our behalf to help create some of the options that we're going to discuss today.
So the depth of their retention is also of importance.
Yes, that could still be a topic, not to make
Back
Dan
into
feel
that pond
uncomfortable,
again,
but yes.
Rachel.
So we're going to go back and forth and be slightly informal. We gave you a bunch of documents in your package, but the gist of this, again, going back to the visioning team, when we set up the kind of parameters and the vision statements for this project, two of them really talked about sustainability, of emphasizing sustainability, health, wellness, and commitment to fiscal responsibility, and to have naturally well-lit and ventilated spaces that improve workflow efficiency, good spaces for our employees. All of these things tie into sustainability and well-building environments. We also heard from the public in our initial meeting about the project that in terms of energy conservation, they really wanted us to focus on energy savings measures that projected to pay for themselves over the useful life of the building. Now in this case, we're designing a building that means 50 years, so we've kind of taken that to be useful life of the equipment or the system that's in place, which, depending on what it is, is 10 or 20
And that was
years.
the discussion we
Yeah.
had
Yeah.
with the public when we had our meetings.
So what our team has already done, we've talked about this in previous meetings, that our kind of baseline project would exceed City of Aspen codes, would be what we envision to be a LEED Silver equivalent building. We'll talk about that. I did include some information about what that means when I say LEED Silver. But for the purposes of where I'm going, so we've already included in our project narrative, our project definition, if you will, a number of strategies that are sustainable, are green, exceed City of Aspen codes, exceed State of Colorado energy efficiency codes. And we're going to hit a bunch of those where we're just going to tell you we're already doing that. It's prudent, it's smart, it's what the industry does. It has a reasonable payback that we really don't need to have a dialogue with you all about. If you want to go to that level of detail, we certainly could. But if something pays back in 4 or 5 years, we're going to be doing it anyway because it's just smart to do it. What we want to talk about today is some of those strategies that are beyond that parameter and that might either have a much longer payback, might not have a payback at all, but might just be the right thing to do for the environment, for the community, for people at large. And so we wanted to get through some of those to get a direction for our team as to where you are on those sorts of things. Does that give a fair representation, John, of kind of where we're at? Okay. So
The yellow highlights didn't come through in our packet. If that's the only one
no,
we're
I
talking
apologize. We had one version that didn't have it and one that did.
Okay.
Steve's looks like his does.
Mine's all very well highlighted.
Mine's not.
I think there's something with the PDF.
There was one version that didn't, and then we caught it and corrected it, and I thought that's what went out to everybody, but,
So what did you say the highlighted was?
So,
Those are the way-
so what Dan has put together is a spreadsheet here that really, LEAD is a good, and maybe this is a good preference, LEAD is a good reference chart, if you will, or a good reference set of systems and topics that we can use to talk about sustainability. So what Dan has done is put together essentially the topics that a LEED certified project would go after in terms of energy efficiencies, recycled materials, waste management, impact on traffic. And he's kind of pulled those out of the LEED program and put them into another spreadsheet where we can talk about them in terms of what we're already doing and what opportunities we have to do more. Is that fair?
Yep.
So this spreadsheet really represents in the left-hand column those LEED categories, if you will. So, and we've had this conversation with John a couple times, and I keep throwing out LEED. Do we want to do a quick little 5-minute what is LEED and really what do I mean when I say that? Because I don't want to presume that everybody knows what we mean about that, and it's going to keep anecdotally popping in. It's not critical to most of our discussion, but I don't want to presume.
I'm pretty well aware of what the LEAD program is, and I can tell you right now, many years ago, I thought we should be leading the way and creating our own LEEDs program. I don't have a problem at all using the LEEDs guidelines to see what we want to do, how far we want to go, where we can do better. I don't necessarily think at the end of the day that we need a LEED certificate.
And we'll talk about that.
I don't think the piece of paper.
Yeah, and that's my feeling.
Yeah.
We don't need a certificate from LEED. We need a
We can lead our own
stamp of
way.
approval from our community saying, you did an awesome job on the building and we're glad it has X, Y, and Z energy saving measures and it's a comfortable, usable building. The staff isn't passing every bug around to every other staff person in the building, and all those kind of things are, to me, more important.
Great. So, Michael, George, Rachel, you good? Just at least with.
Yeah.
Okay. So that really is our kind of first topic here of certification, whether it's LEED or there are other programs. I do a lot of Green Globes buildings these days. That's one of the alternative programs. All of them come with some price you pay for the actual certification and some set of points that you have to go get a certain number of points. Our team is recommending, as kind of just was expressed, that we want to focus our dollars on strategies that have an impact and not just chase a point that really doesn't have an impact. So we're recommending that we don't chase any of those certifications, whether it be Green Globes or Energy Star or LEED, but we focus all of our dollars on strategies that have an impact. And we wanted to get your concurrence with that as a...
I appreciate that a lot.
And we'll kind of move through this, and at some point we'll ask for an okay on all of it. So as we move down, and again, the screen is almost useless at this point, but I'll leave it up there.
I do have copies if people would like a printed version, but it doesn't have the highlights.
No, I got it.
Okay.
Isn't this our package?
Yeah, everybody got that highlighted copy. So the next, as you go through the LEED sort of stuff, the next one would be about location and transportation. Well, clearly, we can't change our location. It just is what it is. But we want to encourage bicycle commuting. That's something that we're already going to do as part of our project. We're going to provide bike racks, probably both external and internal. Right now, our program has that we'll be doing a shower facility for our employees so that when they do bike, they have a way to get cleaned up before work. So we really don't think there's anything in that particular category that we're not already doing. Electrical vehicles, so here comes our kind of first discussion point about dollars. Our parking garage is really, as it's currently envisioned, intended for sheriff vehicles, maybe some courts vehicles. Right now, we don't have any electric vehicles in those fleets, but certainly over time that could change. You can see there's some dollars in the second to right-hand column that there's some levels of charging stations that, depending on how fast and what your vehicles are. Our team is recommending that we have enough electrical service in the building to add this later, but because we don't have an immediate need and it's not a public amenity where the public could come use it, that really we wouldn't recommend spending dollars in this garage for that.
Thank you. You know, this tags in with kind of a broader thought that I had about this whole package, reading through. And this is a 30, 50-year building, you know, at least 50 more, you know. So I think it's important to think about things in a way that they can be phased in without massive retrofit costs. And so, you know, even if it's a system we're putting in now, but we know it's going to have a life of about 10 years, 12 years, whatever, how easy is it to pull that out and put the replacement upgraded system in? You know, the access walls or panels or things like that. So in terms, for me, I'd like to think I don't need a 7-year payback because it's a longer building. But the main thing is that the technology is most likely to change over 10 years to something more efficient and better. And so I have no need to front load it with everything that's out there on the market today if we build it in such a way, design it in such a way that we can upgrade as better systems come online and as a need presents itself. But I went through the whole electrical police vehicle with the city of Aspen, and it's very hard to find one with enough battery power for when they're stationary and parked at a site for several hours and need to keep their lights on and things running and things like this. And so they have found some, but it's a very limited duration in town type of vehicle, not a vehicle you're going to be running up the frying pan. And so while I think we may, as a country, be there in 15 years, I'm not sure we need to add that expense into the parking garage now until we have that as part of our fleet.
But this is just preparing the voltage or the electricity, not actually.
This isn't the cost. This
well, the added
here is not the cost of the voltage. It's the cost of actually adding the things.
Correct. The cost in that second to right-hand column that's highlighted on some sheets would be the cost to add the actual station.
Right.
What I'm suggesting, our team is recommending that we would have electric service, the capacity in the building
Yes,
to add this technology later. I think we're on the same page.
The way I'd like to move is that we're prepared, we're, you know, we're set.
We're on the same page.
I would agree. We should assume that every vehicle will eventually be electric. But are they going to all be Teslas, or are they all going to be Nissan Leafs, which have different kind of charging systems? So until we actually have the vehicles, I wouldn't put the charging stations in, but make sure we have the wiring in there so we can add it.
Yep.
I think we're
I totally agree with that.
Okay, awesome. So moving on to the next item, a green roof. So green roofs have several purposes. We're actually doing a green roof on the library. For those who may have forgotten, we're doing off the terrace over the children's. They have several functions. One is they do have that kind of well-being sort of a feel to them. It's a nice green space outdoors in what otherwise would be either a roof or a hard patio. But they also are designed in a way that they can filter stormwater, rainwater through whatever that media is and clean it before it gets to the river. So our project has, one of our challenges is how we're going to deal with stormwater. That whole kind of swath across Rio Grande has some challenges about how we're all, our project, the city's project, how we're all going to deal with stormwater. So there may be a requirement upon our project to do a green roof in order to deal with our own stormwater. So we may just, that may be the only solution we have, and if so, we'll need to do it. So the question more to you guys then is, if we find a different solution and don't have to do it, do we want to? It's not an item that has a payback. It's really not something you can really quantify in terms of a payback, but it is, could be an example of how to do it. It could be show, you know, kind of leading the way.
It's a lot of money. Everyone's sitting here saying that. I think there's other benefits of a green roof that we're really not discussing, and one of those particularly is to alleviate the heat sink effect of urbanized areas where there's not a lot of green, and improving air quality and things like that. I guess I'm less comfortable or confident about their ability to perform at our temperature range and our altitude, you know, and this is 2016. I don't want to look back to previous failures from the 80s, but we do know that they tried the solar at the airport, it didn't work over time. They tried it here at the post office, didn't work over time. And I think there's been some, you know, literally the roof of the parking garage was a green roof, but it leaked horribly and really was part of the problem. So I guess I'm less comfortable with that, yeah, as a solution, if there are other solutions.
I agree. I think the long-term maintenance, there's not just the cost to install, but the maintenance of a green roof. And I'm the, you know, I'm the grower of just about anything you can find to grow, legally. Which you can do now, I guess.
Okay.
I don't do that because I have too many neighbors next door.
Center.
No, work at a garden center. The other thing, though, is if we have a deck, a patio area on that third floor for future development if needed, that might be a place where we could put in some kind of deck flooring that actually does compensate some of our stormwater issues. And on the longer term for stormwater management, we really do need to work with our neighbors, on their project to try and consolidate our stormwater issues into one solution.
Which is what we're working on.
Yeah, I really think that is a key area where we need to have the conversation and work with the city of Aspen.
George?
Are all these suggestions, do they include Plaza One for the remodel as well, or just for the
Yes.
new building?
Yeah, we still look at it as one project
Okay,
combined.
it wasn't clear from the memo.
But for example, the green roof, I don't think we would try and retrofit the plaza,
Yeah.
so the green roof would really only apply to the new building.
All right, good.
At least we can say that deck space.
But George, like when we get down to talking about energy standards or solar, those sorts of things, it would apply to the whole building. Yeah.
Yeah, if, I know Chicago's really going huge into green roofs now, which will help them with their urban heat sink things, I think, immensely. But if we had a choice between, well, should we put up a hot water solar system to heat the hot water for the building or do a green roof, I'd put up the solar panels and make sure the roof doesn't leak and is a low maintenance roof that doesn't leak, to me would be more important than having it be a green roof.
Okay, the next one, rainwater management. Again, we've got to follow all the City of Aspen stormwater requirements, and there really isn't, you know, a topic to discuss there in terms of options. We get into water efficiency, irrigation. Again, we will be as low irrigation as we can be given our
No, I was just going to keep on with your thing
our,
about irrigation.
you know, our planting up here, you know, I don't think anybody has the intention of being a xeriscape desert sort of a look for any of this, but we'll continue our efforts, because I think we already are, trying to be as energy efficient as we can.
Well, I'm going to look at Rachel here on this one. It's my understanding that the state of Colorado is looking at changing the law to allow people to reutilize their rainwater. And I think that's another thing we need to be looking at as far as our irrigation systems. And that also would help with our stormwater issues, because then we're doing what Mother Nature wants us to do, putting it back into the soil and letting it percolate before it enters the river.
I think it's a long way to go, unfortunately, with legislative. It's been killed a couple times. They've approved a couple pilot projects, but they're only in areas where you can kind of prove that there's no way this is ever going to make it to a river. And we are real close to a river. So I don't know.
I think it's something we should still be keeping an eye on.
Yeah, keep an eye on it.
And actually, maybe even some of our energies down at the State House, we need to be looking at getting that passed through, because it makes sense for the whole state, really. And the most ridiculous thing in the world is you can't capture your own rainwater and even use it to wash your hair.
Yeah, we used to design some buildings in anticipation that that would pass sometime soon, and you take your rain gutter water, and after a couple of years, it was clear that it wasn't getting much traction, and so the cost just wasn't worth it, because it just didn't seem like it was ever gonna.
But again, the same sort of concept with my original comment. If we can think about phasing and retrofitting as we design this, so that if there was a gutter spout that, you know, could be taken down fairly easily, that's where we have our barrels, and this is how we're going to hook the irrigation to it, that'd be great, you know, just to do a little forethought.
And that's an easy sort of thing to do.
I could see, you know, if one building could do this, if provided Colorado water law changes, so
So we
it
can work on
enables
that.
it, that the water off this roof could be used to irrigate the landscaping around here. Every other big building in Aspen the same way, then the city of Aspen could leave the Wheeler ditch water in the Roaring Fork River and bolster that.
Yep.
So all the buildings put together could have an effect, and if we make it, don't preclude it sometime in the future from being able to do that without putting a bunch of money into it now, because the Colorado water law doesn't allow it right now, so. George?
So then are you thinking about using gray water for irrigation?
Well, that's what we're saying. Colorado law won't allow you to use water twice. That's the issue. You can use it once, and if once it lands on your roof
No,
and
I
comes.
mean internal water.
We can't.
It's a
That's
return
a second
flow.
use.
It's a return flow to somebody
Yeah.
else.
It makes all the sense in the world, but you can't touch the water twice because the downstream water rights trump.
Yeah, I'm thinking about the city of Aspen
Using
using
it
it as the
twice.
golf course.
I mean, gray water gets used.
You had to go through years.
RMI is using gray water for their irrigation system. How are they doing that, Dan?
I thought that they were just preparing for gray water use. I don't think they're doing it on day one.
And the city
And
had to
there-
go through years of,
On the golf course.
yeah, to bring it up.
There
on
actually
this.
was a gray water bill passed the Colorado legislature, but it's in like a pilot kind of a thing now. It's not that everybody can go and do it.
Well, and gray water is, you know, that's, you don't want to mess with gray water. You know, people wash their hands in it. Why are they washing their hands? Get rid of the bacteria. So you spread that around, no thanks. You can do it
Just
at
don't
your
eat
own
the
home, and
grass.
you don't know what people are putting down the drains. So it's a really much trickier problem than just Colorado regulations. Do you want to use that water?
Yeah, at Front Range, there was a lot when they were on water.
Yeah.
They fill up buckets in the shower and then water the lawn, and then the lawn would turn all sorts of crazy colors. So let's move on. So the next one, efficient plumbing fixtures. We are going to use low flow everywhere we can. The one discussion point here that really isn't a dollars and cents discussion point, it's more of a occupant comfort, well-being sort of a thing, is waterless urinals.
I have no experience with it. You guys.
So looking to this side of the room.
Make the decision over there.
It's up to the gentleman in the room.
They seem to work great on the ski company mountain restaurants.
So one of the topics that we may not be of one mind about, because I've done them. I've done them a lot of places. I've done them and torn them out. In a place where you go once. So this is what we've heard, and he'll give you the other side because that's not his experience.
shitty
But
discussion.
where you go once and then you leave, and whatever issues might be about that urinal in terms of stink or uncleanliness, you really don't care. You're at a restaurant, you just hit the road. But if it's in your office and you're going there several times a day, it starts to be really, do I have to deal with this? It is a maintenance thing. If you maintain them well, they're fine. And we have lots of clients that use them. Colorado Mesa uses them. I just used it the other day. Maintain, clean, fine. You wouldn't know the difference. But it is something that puts a burden on the facility staff to have more people or more trips to keep them changing the cartridges and cleaned out so that they don't get to be a nuisance. And in this case, the dollars and cents, there's so few urinals that'll be in this. It's really not a first cost, or an operating cost probably goes up a little bit, first cost goes down. It's kind of a statement thing.
What I would add is we installed one at SGM's office 3 or 4 years ago where folks are using it on a regular basis, and I don't hear any complaints. Granted, I'm biased, you know, because I like the idea of conserving water. And I would also say that I promise you, you'll never have a water break at a waterless urinal. So there's some maintenance offsets that aren't easy to compare, but it's out there. So, but ultimately, it comes down to Jody and whether or not her staff is comfortable maintaining.
Well, I would just be curious to get some information from the ski company, because that's fairly new, the last 2-3 years that they've installed those, and just...
They've had them for more than that.
So just to get some information in terms of the odor, the maintenance, and how it's worked out for them, because obviously they're getting thousands of uses every day.
I will say they continue to put them in every new building, so...
So they must have good success.
Yeah, when you're pumping water up onto the hill, your desire to save water every place you can certainly increases. In this case, I think it's as much for how many we have, which is maybe 5 or 6 in the whole building when we're done. We haven't finished the bathroom designs yet. It really comes down to would we be okay if some employees weren't thrilled that that's what we had and didn't feel like, well, sometimes when I go in there it's a little smelly, and sometimes I want to pour a cup of water in it.
Right, and I would just say, we did have one over at the courthouse on the lower level for about 3 years, and I think the courthouse infrastructure with the pipes and, they're 100 years old behind those walls, and I think we had some other issues with it, but we got so many complaints of misuse and odor and the maintenance that we ended up pulling it out. But again, we're looking for direction from you. We'll maintain it however we can, but I think we're also looking for that commitment that if we go there, that we don't tear them off the wall just because we get complaints, but that we're committed to it.
Yeah.
My staff is committed to making sure that they work and work well.
Michael?
Yeah, I'm a little uncomfortable discussing urinals. I'm much more interested in the policy of it, which is, you guys decide amongst yourselves. There seems to be some internal discussion. You guys decide amongst yourselves which is the best, and that's fine with me. I don't want to go fixture by fixture by fixture on this thing. And the discussion of urinals, in particular, I don't want to discuss. Okay.
Gotcha.
Can I just ask about urinals?
Yeah.
Are there low-flow urinals?
Yeah.
So let's just do low-flow urinals.
And I was going to say the same thing. A
Happy meeting.
low-flow urinal uses way less water than flushing off the whole toilet.
So I'd rather have people to use a low-flow urinal than to say, I'm not going to use a no-flow urinal and
Use the
use the toilet.
Yeah,
flush.
we'll hit it in less annoying sort of contexts, because it's a very minor thing that doesn't really have any dollars. On the second page we'll hit, but it's kind of that occupant sort of experience versus the desire to absolutely max out our water reduction, or are we willing to, hey, we're willing to trade off just a little bit on that water use for increased occupant comfort and ease of maintenance and all that. And so it's really just a trade-off. And we're saying, if we go to the low flow, we're going to back off just a pinch on water savings, but our maintenance costs will be less and our occupant comfort, we think, will be better.
I can agree with that.
Okay.
Also, the water's going into the Roaring Fork River, either down Castle or Maroon Creek or out of the sewage treatment plant.
Yeah.
Same amount of water is gonna be in the river if we use a little bit for flushing them. It's not really consuming water.
Sounds,
Yeah.
You know, this is hard for me because I don't have the experience. But this is being presented to us without how many gallons a day are potentially saved with water. And that's missing information. Are we talking 50 gallons? Are we talking 400 gallons a day? What is the annual potential savings of water? Because it is coming out of those creeks, but it's not rejoining until the other side of the Airport Business Center. And so you literally run into that same issue we have with hydro of dewatering certain stretches. And I think that, you know, I'm not going to force a solution that's not a solution, that doesn't work, that has continuing efforts. But right now, I'm hearing 2 anecdotal stories about experiences. I'm not seeing anything that's, you know, I hate to say a research paper, or what are most people's opinions on this, or, you know, those designs from 4 years ago are horrible, but the new ones are fine. So I feel like I'm trying to make a decision in a vacuum. I mean, our community strongly endorsed the Healthy Rivers Fund. We have an issue with trying to keep water in our rivers. So I'd like to do that, but, you know, not if it is de minimis and a hassle and something that's, you know, forgetting just our employees, the public that comes in to use the restroom. You know, I don't want to have a negative experience, but I'm also not going to cling to the past just to make sure that's not a negative experience. So I could see low flow, but I also could see the waterless, and maybe that's, you know, just one of your 3 restrooms is done that way, and we can gauge it from there going forward. But I don't have the quantitative information to make a good decision here.
we can certainly bring back some anticipated gallon savings, annual basis.
Something like that. I mean, we are meeting tomorrow, and if you, or that sort of dropped dead, we could talk about tomorrow with more
And this
information.
is a simple one, that's why I didn't want to,
Okay.
I agree, it's minor because it really doesn't have a big impact. So this next one, high performance energy efficiency, is where we get out of where I can even speak intelligently, so I'm gonna let Dan talk about this item.
Sure. So to get into Michael's point about, you know, the policy, really what we're looking for is some guidance on overall performance. The mechanical engineer still has a few alternatives out there that all will work well. And the idea is for you to give us overall performance guidance, and we'll find a system that will achieve that. So in the packet, there was a table where I tried to give some perspective so that, Rachel, as you point out, you can have some numbers to base it on and essentially bracket performance. I mean, the Rocky Mountain Institute building is certainly the best performing building that you can even look at right now, which is about 17 kBTU per square foot. kBTU per square foot is also called an energy use intensity. It's kind of like miles per gallon. So that's the number that we use to talk about performance. It includes envelope, mechanical systems, windows, all that. Boils it down into energy use intensity.
But that building hasn't been driven very far, so.
Right.
So.
Not at all.
We don't know anything about it, really. I mean, it's a theoretical.
Right. And that brings up a good point, that the way we look at this is energy modeling. Not a lot of buildings, even more recent buildings here in Aspen, have done a good enough energy model to know what they were really shooting for. So some of this, to be honest, kind of keeps me up at night to say, well, can we really achieve this? Because we don't have a lot of good data in terms of good energy modeling, which projects it. RMI did a lot of modeling, and they can feel pretty confident, and I feel confident in their numbers that they'll achieve that. So what we've also used to bracket it is, what is the performance of some buildings? What have they actually achieved a year, 2, 5 years after the building has been in place? So some buildings, the NREL Research Support Facility, that had a lot of momentum and research behind it, that's achieving about 35 kBTUs per square foot. Likewise, the EPA building in Denver is achieving 40 kBTUs per square foot. If you were to just build to code with the city's newly adopted 2015 International Energy Conservation Code, you'd probably be at about 72 to 80 kBTU per square foot. So you don't have a choice. You're going to achieve 72 to 80 no matter what. To me, a stretch goal is that 40 kBTU per square foot that the EPA region achieved. That's a similar building. It's an office building, but it's nowhere near what RMI is doing at 17 kBTU per square foot, where they're not even installing a mechanical system. I think 40 kBTU per square foot is going to be hard. And it's going to require maintenance and attention to the building to make sure you maintain that. But I think it's a worthwhile goal. I think you can achieve it with any of the systems that have been proposed. But that's where we're looking to you for some guidance.
And then that would be about a 45% more efficient building than what City of Aspen code would require. And anecdotally, because it's tough to get information on this building and really what we're, it's tough. Dan's number is for sure more than 50% better than what we're doing now.
Today.
And I'm sure it's more than that, but it's tough to generate those numbers.
That's if we go to 40, or if that's if we go to the standard at 70?
If we go to 40.
Yep. George?
So, Dan, you said that we may incur higher maintenance costs, but wouldn't those costs be offset by the energy savings even more so? I mean, do we have any idea?
I don't mean, I'm sorry if I misspoke that you'll incur more maintenance costs. What it means is, it's been our experience that for a building to really perform over time at these targets, you have to be on it. You can't just put it in automatic mode and walk away from it. I think Jody's staff is getting a lot more familiar with building and automation systems than they were 10 years ago and 5 years ago, and some of that helps in that maintenance. I'm just pointing out that it's not an automatic. You don't walk away. You got to have a staff that's going to be dedicated to that performance over time.
Right, but the energy savings, because I'm assuming we're going to need to probably add staff to address a lot of these
It may
issues.
not be staff, it may, though, be expertise in coming back and, resetting systems, those sorts of things. I think my experience, and tell me if this bears out in your experience, is that the more modern, efficient systems are also more complex. And so when you have a more complex system, something tends to go wrong more frequently. And so we may have more resources going into contractors that are helping us maintain those systems at their peak operating levels, or there may be more regular maintenance associated with those systems. And so what I'd expect is costs there. Whether it would be staff or not, I think we'd have to evaluate once a system was designed. I think what we're looking for now is, are you comfortable? We think a stretch goal is to go to this 40 kBTU. Also given the comfort standards of this building. I mean, a lot of how RMI has achieved, their goal, I think, is accepting a broader range of highs and lows, for example, in temperature, and that's good. That's the culture. Then, maybe we would accept in a building that has such a diverse set of uses and a diverse audience. And so we think with that 40 kBTU, we can keep kind of the range that most buildings are accustomed to. We would be looking into what mechanical systems or combination of systems and practices, which will be our next discussion, we'd need to get there and target that. We think we can, this is probably the area where we have the best opportunity, given that our site's already selected and such, to achieve some environmental goals. The 40 kBTU we think is aggressive. If you want us to go farther, like if you wanted us to go to an RMI, what we're going to need to talk to you about is comfort standards. I know we have 2 space heaters already in this room right now, and we need to talk about, what is the balance point between what we want the experience in the building to be and what our energy conservation
Yeah, I mean,
is.
I don't see us trying to meet an RMI standard, because they're a
Showcase.
they're a showcase,
world.
exactly. They're sort of testing the newest But we could use that information, and so when I look at all this information, when we look at the costs, our biggest first upfront cost is the capital cost, the project. But then where we should be generating savings over 50 years is by utilizing these energy savings mechanisms.
Correct, and I think in this, it would be recommended because we do believe that the savings would more than pay. Yeah, if that was your question, sorry, I went into that complicated answer.
I would see, to me, this would be perhaps the most important thing, to shoot for the 40. We have a different site than RMI. They're in a lot sunnier location than we are here, so, it'd be hard to achieve what they're achieving. And they're doing a lot of it by having the electrically heated chairs and stuff like that for comfort.
I hate
But this is where we can save coal and from burning coal and natural gas by making this, the shell of it and the insulation, the efficient HVAC system and the LED lighting and all that is like real savings on fossil fuel consumption.
Yeah, and all those things you just talked about are really integrated into this kind of decision point of envelope our values and how tight and sealed up our building is, and the window glass specification, the lighting, the heating, the cooling, all of that's wrapped up in setting this goal. And then by setting this goal, we can kind of balance those integrated systems and get to the sweet spot of hitting this number.
I don't have a problem shooting for a number less than 70. 40 would be great, but having to be fiscally and environmentally responsible at the same time, I need to see the cost benefits or the cost that, we have a budget. We have a lot of expenditures that we don't even know we're going to incur along the way. And so I think as a member of the Board of Commissioners, I have to be looking at that too. So I would like to see something, if not 40, but somewhere definitely less than 70. But I think we need to look at what those steps may cost us. And I know there's the payback over the years, but we have a budget to start with now.
And it was our intention to have the energy model completed. Unfortunately, with the design to be cost effective, we haven't started the energy model until the design is a little bit more finalized. But once we do that energy model, we can give you exact paybacks.
That's perfect. Thank you.
Rachel?
Yeah, I would like to make the 40 our minimal target. And if they're, if we end up with 38, 35, great. But, a little bit of different point of view on that. I just look at this as being, a 50-year building. And I know that when you put things in the beginning, it's so much cheaper than ever trying to retrofit or add things back on later. And so this is the area, I think, where we have the most potential for payback for the initial investments. And I do believe we have a budget. I don't want to break into general fund any more than necessary, but we also have other resources. And if it's going to, make a significant impact, then I would certainly look at those. So I look forward to the numbers you bring back.
And another thing to add too is we have to look at the technology and stuff that we install at the get-go, maybe 5 years, maybe 10 years, so we have to revisit that technology. So we need to be looking at, if we upgrade to this level in 5 or 10 years, are we going to have the funds to upgrade to the next level that we have to, either because the current level of the equipment fails and we have to replace with new technology, or with, again, the same. I think we need to be keeping that in mind in the permanence and the long-term, the longevity of our building.
So is it fair to say, just to get some clarity, for me, one area where I'm willing to fall on my sword is the envelope. Put it in the insulation, the windows, because that's really difficult. So that's where I'm going to really push. That's one of the big reasons why I think we can achieve this. And then 15 years, 20 years down the road, you retrofit equipment. That's not so bad, but...
No, we don't want to retrofit the building. We've tried to do that.
The envelope and build a good shell.
I totally agree with that, too.
Okay, great.
One of the things when we bring you back the dollars, because this isn't entirely, it doesn't have to be entirely a dollars and cents decision. We're going to talk to you also about, in order to hit some of these numbers like RMI, if you remember when we did the tour, it's about occupant comfort and temperature settings. And how they get to that number is saying, we're gonna let the temperature be 62 degrees in the wintertime and you're all gonna be wearing sweaters. That's how they get to those numbers, is an operational component that impacts employees. And so not only the dollars and cents will bring you the kind of functional, here's what this means, and we all have to be willing to say, if we're gonna hit this number, we have to be willing for our building to be 78, 80 degrees in August, and we all go, yeah, that's good, because we're saving money, and that's okay. RMIs, when they're wearing their sweater in the wintertime, they're feeling good, because they know that's how they get to that number, and they're wearing it as a badge of courage, so to speak.
So what's the temperature in this room right now? We're kind of used to this
Little
kind of
chilly.
temperature.
Little chilly. But that's kind of one of the things, is
Yeah.
when it's, not in this room, but in a new, well-designed space, cooler is saving you money this time of year.
Michael?
That's what my grandfather did. I mean, he put on long underwear in November, put on long underwear in November and took it off in March. I'm sure he changed it once. But I mean,
I don't know what kind of urinal we used, actually.
but the real difficulty is, no, you have these figures, right? But then you have individuals within the building. And some of them put on hats, and some of them prop open the door. Or some of them add heaters. So what do heaters tend to do? They warm the person next to the heater, and they drive down the temperature in the room.
So the rest of us get cold.
And it uses electricity that fights
Yeah,
against this.
so you know, it's a very funny thing. I mean, we're talking just a theoretical level. And I'd said this before, I'm more concerned about how people use the building rather than the design. And people are funny. They will completely subvert a mechanical system because they don't know how to use it, but they know how to subvert it. So.
And that we've got some.
We're going to hit
questions
that here
coming
on
up
page
that.
2.
Yeah.
Another important consideration, this is a public building with members of the public coming in to go to the clerk's office, to go to commissioners' meetings, and if it's 62 degrees in there and they're cold, they're not going to be happy campers. The staff can probably adjust to it, but it's like there's people in and out from the public all the time, and we have to remember them.
Yep.
We'll hand out blankets like they do in the gondola.
We're assuming standard set points. 70 heating, 75.
Yeah, we think we can do the 40 and still maintain the temperature levels that we want to do. When you start to get past that is when we start to bring that other component into the dialogue of.
I'd still like to see the cost.
Yeah. Oh, yeah, yeah.
We can skip 9 just because it's more informational.
Yeah, you got a report from Jody here a little way back about the dashboard and all that, so we'll continue that here into the new building. So solar, photovoltaics. So we're already on 100% renewable energy, electricity for the building.
Rachel?
Yeah, I guess I don't have it in front of me, but I thought the city, I don't know if they've actually bought some share of turbines now. It's not that a wind power contract through MEAN that has to be renewed regularly. I mean, I think there's a whole stacking of different contracts they've had, because I was just wondering whether that's a for sure thing forever, that the city's 100% renewable, or if they start having issues in the future when they come to renew and then say, hey, we can't do any more because of our base loading and things like that. So I had a little bit of a question about that. And then the second becomes, what's wrong with still putting more energy back into the grid? Just because the city's been able to make these advances through their electric rates and utilities, you're paying for that wind power purchase through your utility rates. And so if we can still lower our utility bills, we're going to be saving, because they've had to do a little bit of a premium to get that sort of power.
Yeah.
I don't disagree with what Rachel's saying. I'm looking at these numbers, the costs. I'm going back to the fiscal responsibility. $250,000 to $500,000 to do solar. Maybe we need to look at that. I definitely would agree with the solar for the hot water, and maybe even tying it in, because we're not going to have a lot of hot water use in our building, but maybe the possibility of tying it into the jail. where they do have a definite hot water increase.
Yeah, in terms of the putting solar on a roof here, there's other places in the county that it would be much more efficient and a lot cheaper cost. And we are doing the study of, different sites around the county that.
Like Public Works.
And this, this roof would be one of the sites that would be being studied, but I would, even though the electricity might be produced in unincorporated PitkinCounty and go to Holy Cross instead of to the city of Aspen, the county still could get credit for that for our facilities outside the city. So I'm not wed to the fact that we should absolutely have solar panels on this roof, because it might not be cost effective to do it.
But
Or
for
if
hot
we could
water-
put the money into something elsewhere that's much more efficient, that's what I would prefer to do.
And see, the only argument that I think, there's probably a couple arguments. I do think we believe right now that the solar would pay for itself over a 10 to 20 year kind of time frame, and the life of the infrastructure is likely longer than that. You usually have to place inverters, that sort of thing. To Rachel's point, I think the argument that we didn't bring out is the impact piece too, that right now that 100% renewable is all produced, not all, but primarily produced outside of Aspen, outside of PitkinCounty. By doing it here, whether we do it at the landfill or on our building or both, all of the above, you're bringing that impact back into the community. But to Patty's point, it's probably 250 to 500,000 that may or may not be anticipated right now in our budget. So.
Yeah, I just kind of come back to what I had thought before, and that I'd like to make sure that the structure of the roof is sufficient so that if we were adding solar panels on later for this bigger opportunity, it would hold it without a lot of expense, without ripping the roof out.
And the design of the roof.
And it's designed that way. When I look at maybe less this building because of the trees, but the back is very sunny, and it catches an awful lot of good sun. And, to the extent the panels could be almost integrated within the roof, but that technology, if anything, is changing so rapidly and improving, and the efficiency so rapidly that that's hard to make a buy now. But I'd like to be prepared for it later and, take a look to how much of the square footage is taken up by a system for just hot water. But I agree with Patty, the numbers make it much more in line to be able to do at least the hot water in the initial. But that's something I just, again, don't have the quantitative to understand how big, how much on the roof, and how much of our energy use would it really cover. But the last comment, we all know electrons are electrons, and once they're fed into the grid, the city may be purchasing wind power there, and then that actually feeds the little communities there, and by the time they pump the power up to us, it's coming from a coal-fired plant. You just don't know once it's part of the larger grid. And the thing that is known is how much electricity is lost in the transmission. And so by generating electricity here that goes directly into the Aspen grid or into our own uses, you're eliminating an awful lot of lost power through the wheeling and the transmission of it up to the valley.
Steve, another thing to bring in again is the working with the city of Aspen.
Has a low cost threshold, but as I know this group has talked about in terms of the recycle center before, there are some components that just have a high price tag to recycle. Drywall is one that, in order to recycle it, you got to drive it to Denver right now. So what we'd like to do on this item is essentially say we're going to recycle anything that has no cost or such a low cost that it's not worth talking about. But if something starts to have a big price tag, we'd come back to this group and just say, hey, this is whatever the issue might be, and we think it's going to have a $30,000, $40,000, $50,000 price tag, whatever that is. Is this something that you want us to pursue? Is that an okay strategy?
Yes.
Okay. Materials with reduced environmental impact, that's both locally sourced stuff and recycled stuff. That's pretty standard in the industry right now. We're all looking because we're all looking for buildings that cost less. Recycled carpets are just about all the carpets you can buy these days are recycled. So that's something that's.
We don't want to recycle this carpet.
Hmm?
We don't want to recycle this.
No, we don't. Well, this carpet might go to someone to
recycling.
recycle
Yeah.
for some other.
Use it for pond liners.
Yeah.
Really?
Yeah.
Pond liners?
They would have a pond full of coffee.
There's actually a new company in Denver that's been open and they have offices in Chicago, where they take just the oddest things and kind of warehouse them, and they'll send out an email every week.
Oh.
We've got all these just weird things. Does anybody have a use for them? We've got a bridge. We've got a.
We know that one.
Yeah, and people come up with all these crazy ways. There was tow ropes, ski lift tow ropes. People turned into railings, and because of the heavy. Yeah, there is a market for a lot of stuff, and we'll do all of that.
Yes.
Until it has some price tag that we just feel, hey, that's something we need to bring back. Storage and collection of recyclables, we'll kind of stick with our standard program. Daylighting our building, again, because of our physical constraints of this, we're going to maximize that to every extent we can. There may be a topic where we come back to you that might talk about some more skylights or more of an atrium component. That's kind of it. We'll just have that dialogue when we get there and see if that's, here's the dollars and here's some of that benefit. But we're going to max it. Healthy materials, again, low VOCs, we do that. That's standard practice. So this next item is really the last one that we need to dig into. It's outside air ventilation. Indoor air quality is the term that's used a lot. And we are going to certainly meet code in whatever we do. We're going to hit this energy threshold that we've talked about. There is lots of schools of thought that having more outside air in a space increases that air quality. Now, the somewhat minority opinion, I guess we'll say, is, well, it depends on what that outside air is, and if there's a bunch of diesel trucks out there and you're pumping in that smoke, theoretically, in that situation, you haven't. But there are studies that employee, efficiency increases and their wellness. Mm-hmm. So there's two ways that you could increase outside air ventilation. One is mechanically. I'm going to pump in more outside fresh air, whatever temperature that may be. And then my system design needs to be able to overcome that. And so if it's today,
Either warm it or cool it.
yeah, so if it's today and I'm pumping in this morning minus whatever degree air, my system needs to then overcome that and heat that to the temperature that we've set. So if I'm pumping in more outside air, I'm competing with that energy efficiency goal in terms of saying I'm artificially putting more in than I have to, and I've got to heat it, but that's more important to me to do than to just absolute max. So the other chunk of that is I can get that outside air with an operable window, which
That'd be great.
is way less controllable of a scenario as we were talking about. Employees love to leave the windows open. They love having the window for that day when you want fresh air, but it does, I'm probably too strong in saying wreaking havoc on these energy efficiency goals, but it really makes it a challenge to hit those energy efficiency numbers if we're doing that. Mm-hmm. So that's the topic for discussion.
Rachel?
Well, it strikes me that as we're doing a really energy efficient building, we're going to be making it super tight. And so I would start to wonder, without this, quote, optimal outside air ventilation, there's got to be some new fresh air coming in, or we're all rebreathing the same stuff.
Talk about
on
percentages
a super
maybe,
tight
or-
building. I'm not worried about in this room, but
The mantra is build it tight, ventilate it right.
Okay.
So that you're controlling the ventilation, the fresh air that you're bringing in. So we will have outside air introduced to every single corner of the building. The question is we can control it with a mechanical system and bring in the right amount with CO2 sensors, carbon monoxide sensors, or no, I'm sorry, CO2 sensors. So base it on actual indoor air quality. But yes, you want to build it tight, but then ventilate it right.
Rather than just a random, I'm opening my window and oops, I forgot to close it.
Exactly. Or I want the building to breathe.
It does have, even though I really appreciate being able to open a window. But I totally understand the conflict.
What is the state of the art of heat exchangers for taking the heat that you're blowing out and preheating the air coming in?
What we would use is, I would say, best practice standards for heat recovery on this building. So we would incorporate that into this. I hate to use state-of-the-art because I don't necessarily advocate state-of-the-art, but we would use good heat exchange technology for this.
Yeah, that was one point that I want to throw out because it is kind of an underlying theme that we've talked about a bunch on the project team is, and I say this all the time, I don't want to be the first person that uses some high-tech, high-dollar system. I don't want to be experimental.
The bleeding edge of technology?
Yeah, and so typically what I challenge these guys on is when something comes up, I go, well, tell me where it's installed and it's been working right for a couple of years. Okay, if it has, super, then we can consider it. But if it's, well, we haven't ever tried it anywhere, we just read about it in a magazine.
Mother
No,
users.
Are we getting back to waterless urinals again?
Well, no, that's not quite that cutting edge, but I can't think of the last cutting edge one I had, but it's.
The one I sent you this morning.
Well, yeah, that was a good idea though.
What was that?
It's a minor thing, but so there's two components there. Am I hearing any advocacy for operable windows and dealing with the issues that will create?
Look, this would be my comment. It might be valuable to have an operable window that is more centered in a hallway, in a small, narrow one, but every now and then you have something where, oh my God, all the toast is burnt and the building's all smoky and you want to get some fresh air in quickly for some issue. And so I could see wanting to have one or two that you could use, but they weren't like within somebody's individual office or domicile in such a way that you lose control of it. This would be something that would be visual and, may have had to have reached some consensus to say, something's going on. Until the guys get the, air cooler again, let's open this window for a while on this floor. Is that an unworkable compromise? I mean, we could always put a latch on it in the future so no one could randomly open it if they didn't want to. And I'm just kind of thinking some narrow or one. It just seems there might be some value to having something like that. You read so often about these big, older school, not good ventilation system buildings, but there's literally no way for anyone to ever open a window if they need to. And so I'd like to kind of look for a little bit of wiggle room in that.
My preference would be to get guidance to be able to handle any situation and let us figure out the best design to do that. I would say that an operable window in a common area wouldn't be the best way to achieve that.
Okay.
But if you say, hey, we want to be able to handle every situation, okay, we'll create the VAS system that'll allow for that to happen.
I think that's why you have doors.
That's
I mean,
true.
that's how
It may be. I don't know, but that's all I was thinking of. It's, because this is kind of a, one of those roads you don't go back and double back. Once you're down there, and so I was just looking for a little flexibility.
Well, the problem is that, from my point of view, if you have, for instance, a spaceship and you control the environment on it, you can't open the windows. You're not going to open the windows. And what we're designing really is a spaceship that controls the environment, that diminishes the energy consumption, and once you open a window, you subverted the entire thing. I know in terms of social habit and that kind of thing, people think it's necessary, but we're embarking on a new paradigm, and it's about technology, and I'm not sure that you can have opening windows and technology. For instance, you're in a blanket, you've got a heater. I'm in a shirt, and I don't have a heater, and I don't have a blanket. So you would be opening, I would be opening the windows, you would be, so it's very, very difficult. I just caution that. It also feels good to be in a building that you can open the windows, but But what we're asking for is a technology solution to opening the windows. That's what we're asking for.
I mean,
George?
for me, it comes back down to the HVAC. And if you have the right HVAC, it's going to take care of that issue. So I would go back to, as you said, that's really the most important component. And if that's really going to function the way it's supposed to function, then we should stay with that. That's what I think.
So George, in my experience, and I think what we're asking, do we lean on the side of the energy efficiency goal or kind of the employer occupant comfort goal? Because everyone experiences 72 degrees differently. Yeah, and some folks are opening the windows, some people are, and so what's going to happen is when we take that choice away, people are going to, they'll be upset about it initially. I think, there'll be initial transition. If we can explain, now we're doing this because we're maximizing, I think to Michael's point, hey, we built a spaceship to get to this energy efficiency goal. That's our value. I think the real question is taking away the operable windows a reasonable, kind of compromise there? It's another version of the temperature range to a certain degree, right? It's a same discussion, but the operable windows probably do more to defeat our ability to reach those energy goals than almost anything else we've talked about. And if you guys are comfortable with that, I just want to be sure you understand we're going to get some pushback in the organization.
Because everyone does have a different internal temperature, so
right.
Some people wear a sweater, some people just have a shirt. So you just adjust, just like you do outdoors. It's the same thing.
I might also add that getting back to the daylighting, I think if we could effectively capture as much daylight as possible, we'll minimize the complaints about no operable windows. So.
But, for instance, the daylight here, we have 2 large windows, but some of us want those blinds shut. And that shows how difficult it is within a common space to have common comfort goals. And I think we have to agree that we're going to wear different clothes, but we have a common goal of high efficiency because it makes for a better future.
Right. And daylighting is important for mental health.
Absolutely.
So people are a lot more comfortable working in a space with the ability to see the world outside them. Whether, and I think that's a huge quality in a structure.
Okay.
Rachel?
Just so I'm clear on where we've landed, the question about operable and inoperable windows was one question. And then over here is, we're obviously going to have an HVAC system, but to provide optimal outside air ventilation, is that still a decision we haven't made now that we've gotten past operable and inoperable windows?
That's true. You haven't provided guidance on that. I feel a little guilty bringing this before you because I also think you're going to want to see the numbers.
Yeah.
And an energy model will help us do that. So I think it's pretty tough for you to make this call right now. But nonetheless, it's
bringing in outdoor air will have a cost to it.
Yes. Yeah.
So we need to know what that cost is and how much do we want to pay for that.
And a little bit of
window.
research on my part to quantify the benefit of more air.
That's important.
Okay, that's kind of what I thought, so
Yeah,
thank you. Because
the huge benefit is the health of the staff who are in the building 24 hours a day. Well, not quite that long, but.
Yeah. Steve, to finish my comments.
Rachel.
Thank you. I think it's a crucial element that we're not talking about here, and that is the noise of the HVAC system. There's been times when it's gone on in this room, and we've had to kind of ask for it to be turned off because we couldn't hear anything. And I've certainly seen that in other facilities. And so I want to go 100% on the soundproofing and the insulation and how that happens so that it's a seamless thing. It's not an irritant for people to hear in the back of their heads all day long as a replacement for the birds chirping. They now get the HVAC rumbling heads, so
Yeah.
that's key to me.
That's a good point, like that limelight room we use.
You just can't really hear
That
it.
noise is going all the time, and if you're sitting in the wrong place, I have a hard time hearing.
Point taken. We'll note that.
Yeah.
And I think that'll address, but Michael has the concern about the noise of the HVAC systems and the serenity of Veterans Park. So we wanted to make sure that we just don't put something in. I swear sometimes at my house, I can hear when HVAC systems come on in downtown Aspen.
Yeah.
I know when things are gearing up for the day. So, that was
All right.
That was good information.
Just the one last section there in the well building standard, I don't think we need to spend any time on it because it's really stuff that will come back later on. But there are a few of those kind of parts and pieces that studies have shown can increase the workplace well-being, can increase worker proficiency, comfort, whatever that may be, and they may have a price tag for us to implement some of those strategies. So we probably will come back to you a little bit later. Like the very last one, the biophilia, if you look at pictures of that, if you look up, it might be a lobby that has a living wall going up through the atrium with live plants that are being fed, and that living, component does have, studies have shown it does increase, your feeling of well-being in that space.
Like RMI has.
There's a cost to that, a first cost, there's a maintenance cost, is that, the right thing for us to be doing? But those kind of strategies are a little bit more targeted, that we can just look at opportunities and say, is this something we want to do here? Is that a fair? We don't really need an overriding driver on any of those. I'm asking, not saying.
I would agree.
Okay.
I would agree. And a lot of them are fit and finish.
Yeah.
Yeah, and some things we have the opportunity to look at alternative funding sources.
Yeah. Well, great. Are there any topics that we haven't covered, that sustainability, green, anything that's in your head that we?
Go ahead.
I was looking through this memo and imagining that there's a whole series of energy efficiency building standards that are either building code or things you've already determined fit within the budget, and you are only bringing us the things that may be
Correct.
add-ons to the budget. Okay.
Absolutely
good,
correct.
Good clarification, because at some point, I'd love to see what else we're doing that is already being pre-programmed into the building.
What we can do, which
Or
we've done on a lot of stuff, is take a LEED scorecard, even though we're not going after that, or a Green Globe scorecard, and just kind of plug in, here's the things that we've done. So really, if we had wanted to, we could be here.
And I'm not saying we need to do it as a presentation or anything,
Yeah.
but as a memo, because it'd be great information for the public to have all in one place.
Yeah, it would be, to that point, what you talked earlier about installation. Are we just meeting code for installation, or are we going above? And if we're going above, what does that mean in terms of cost, in terms of energy savings?
We're going to use our energy model to find the sweet spot for all those things.
Right.
Yeah, there's a
Based on
certain
that
point in roof
40 to
insulation
70.
where once you go beyond X, adding more doesn't really help you any, because there's other places where that same heat is leaving. And so his energy model, that's all computer-based, dials in all that, the best glass, the best insulation,
Right.
the system that you're putting it into, how much fresh air, and dials in the exact right sweet spot is the great word. This is how we're maximizing our dollars.
But this gave us the high-level kind of guidance to be sure that as we're making those decisions, we're making the right kind of compromises. We also know what needs to come back.
Great.
So,
Thank you for your time.
Yeah, and we're still working on the updated elevations from our last go-around with POS. We're just making sure they're in a format that we're comfortable we could proceed from that point on before we bring them back to you, but that's coming here shortly. We're in the next week or
Play
two.
with the design stuff.
Yeah.
Very good, thank you so much.
Okay.
Thanks, guys.
Thanks very much.
Thanks, Dan.
Appreciate this in-depth look at this stuff.
So we're going back to open discussion, right, Steve? No, just kidding.
Yeah, do we have any more? No, we're gonna,
Do
we
that
have
tomorrow.
some items we're gonna do tomorrow on our open discussion tomorrow, and thank you, everybody, for sticking
Good
with
day.
it today.
So
And
do you need to go over tomorrow's, or are you good?